we have such a cool patient.
Yeah, thank God. We are on.
Yeah, take some pictures. So what are they seeing? They're seeing me?
They're seeing, yeah, they're seeing from this one now.
Okay. Morning, everyone. Alright. So face me,
Yes.
and we're gonna take pictures. Perfect. Maybe a little bit more towards like this. Yeah, but like your whole body. Oh, yeah, nice. That's perfect. So Marco, if people have questions, you're able to see that?
Yeah, yeah.
So maybe just like, I don't know if you want to like write them down, because I won't always be able to answer them.
I can pull up the live stream on my phone and have the access to the live chat there.
Okay.
So I can just read your question or give you the phone or whatever is easier for you at the time.
Okay.
Do you want me to do a 360 before you move the marks?
Sure. Okay.
So I'm over here, and you're going to be sitting on the chair.
Sure.
Going to swing in the chair.
Oh, thank you.
Yeah.
How's everyone doing? Good morning. What?
The back
Oh, the
one.
mic's up
Yeah,
here.
exactly.
Oh.
If you direct
They are not
here.
doing anything in the
But you
back
see
right.
here, you can see in there.
Oh, okay. Any questions so far?
No, just so neat and morning and good luck all.
They are not working in the back right.
No.
Okay, so that's good.
Okay. Alright, so let me just wipe this area here. I guess just try to stay out of the line, Andrew.
Yeah, I'm on the corner.
Do you want to say anything about the area or like why you decided to do the procedure, anything like that?
Sure.
Okay.
So, hi everyone. My name is
Marco, is it on?
Jonathan Constanza, and the reason I decided to get this procedure is because it's been a long time, almost 27 years, and now that I'm progressing in my career, I'm a financial auditor. That's kind of everyone like it became like a talking point at some point. So now I feel like I want to be normal, and that's what I'm looking.
Cool. So yeah, so we have this area, and you've been missing hair here since birth,
Since I was
right?
born. Yes.
Yeah. So you can see, maybe just show them the other side.
Oh yes.
Yeah. You can just see the difference here. This is obviously a very normal temple. You can see there's like this very slight normal recession for his age, and the temple here is nice and filled in, and it's projected anteriorly. And then if you look at his left side, there's this obviously missing area. And so our goal today is to try to match the two sides and fill in this patch and put hair there. So that happens. Sometimes there are congenitally missing spots. So as you guys know, I have alopecia areata, and that also can come with, oh, you have it on there. That can also come with these missing kind of circular regions. But in Jonathan's case, it's really just more of a congenital thing. So, you know, it's a different type of etiology, but it's, you know, it's actually more amenable to a hair transplant than an alopecia areata spot. With alopecia areata spots, like let's say this formed a few years ago and it was alopecia areata, you have to be very careful with transplanting it because it's autoimmune, so the body tries to attack its own hair, right? So we'd be a lot more careful offering him a hair transplant than in a situation like this where he's had this his whole life. So it's not stemming from an autoimmune condition. So that's why we're here today. to fill in that area. So I'm going to proceed to doing markings. So for me here, I'm working on trying to figure out some degree of symmetry, but you have to realize, everyone has to realize that the face is not perfectly symmetrical ever. So there's always going to be a little difference from one side to the other, but our goal today is to try to match things up as best as we can. So I'm constantly going back and forth one side to the other, and usually I make some initial markings and then we have to redo some of them. I mean, that's totally part of the artistic process of this. There's a lot of iterations before we say, okay, we're now happy with how it looks. I'm always getting patients involved in this process too, so as soon as I'm more or less happy, I'm going to show him what I think might look good, and then he's going to tell me if he likes it, doesn't like it, and then we make adjustments from there. So slightly higher pitch this side. But this part always takes time, you know. I don't ever see a reason to rush through it until it's done. This is like the more artistic part of the process. Looking pretty good, but take a look and let me know what you think. I know it's just dots because I like to kind of work in between the dots and make it a little bit more irregular, but let me know what you think and I'll do some measurements and stuff, but just as a general. I felt like this should come down a bit to make it a little closer to here. See, like when I put my fingers on it, a little bit more even than if I had started it up here, because this would have been lower. And then I was trying to match the pitch going back here to the sideburn. Like, you know, this kind of goes back and then it drops down. I think that's close.
Yeah, that look good.
This runs back a little bit more. Well, it's close. It's close. This might drop down a tiny bit, but at least it gives you something to work with, you know, because you can always, you know, because you have hair here. It's just like the way that the cut is. So I'm thinking this kind of makes sense, and it then smooths out into the sideburn. What do you think? It's okay to your eye? Okay. Okay, cool. So yeah, so those are the markings, and I don't like lines because the little dots force me to make it more irregular when I actually put the grafts in and make the sites. So we go in between the dots here. Okay. I'm just gonna adjust one of these. We don't want it to look too perfect either, because hairlines are never perfect, and if they look too perfect, they don't look real. So we always want to introduce some irregularity into the design. And we'll do that again once we actually start making sites, which is coming up soon.
We have 100 people watching.
Nice. So now that that's done, I'm gonna start to mark into the area where we're gonna also be focusing beyond just the hairline itself. So now you can see here, and let's show them again, like your other side, the right side. So, but just to show you, some of the design here has to do with the actual haircut. So there are still hairs that are outside of this zone. So in designing that side, you know, that's something to keep in mind. But you can see how a natural hairline has this irregularity built in. It's not just a line of hair. It's more kind of scattered, it's more irregular. So we try to recreate that when we do the actual transplant. Okay, alright, so I'm going to just mark the whole. So I'm marking now the whole region where we're going to be working, where it looks thinner. So let me show you here what I've marked. Take a look there. So you can see these dots going around here. You agree? That zone?
Yes.
Okay. Obviously I'll go a little less dense where there's already some hairs, and then increase density as we get further back, because you can see it's like light right in the front.
Correct.
So that's going to be our like more like single grafts over here along the borders, and then we're going to put the heavier grafts in throughout the rest and try to make it as close as we can. Okay.
Let's go.
Cool. Take a picture here. Good, so now we have our area marked out, which is great. So I'll start to get my team into position, and we'll keep going. One sec. You feel
Sorry.
okay?
Yep, I'm feeling
Okay.
good.
Let me give you a gown. Marco, look in that white bin. The big white bin, yeah. There's a blue gown inside there. See the should be on the left. Yeah, just one of those. Just throw that to me.
Here you go.
Thank you. Okay, great. So what we can do is that's a really nice shirt. So let's have you, and since not in front of the cameras, we'll have you just change
Yes.
out here. I'll put it next to the other room. Just so you can throw the gown on, and then you'll put that on when you're leaving. I have a scissor here. Just follow me. We'll be right back, guys. You change into a gown.
Oh, should we do that once it starts? But we gotta make sure it's not buffering. Wait, where'd you put it? It's gone home. Oh, the only output we had is that MacBook system doesn't work. The only big, but here's gonna put music in it. So it's not putting copyright. We have to tell them to put no copyright. No, Justin Bieber.
back. Are we putting on mood music?
Yeah.
Okay. Alright, Ruel, you're good over here?
Yes.
Is this shape? Okay.
Let me just have like a cap.
Just gonna get my.
There's the surgeon's cap. The front cap. Okay, no cap.
Oh yeah, we'll get you a cap. There should be one there. Jen?
The front, it's here.
Jen?
That's what the movie.
I found it.
Oh. Okay. Great. Okay, just gonna get that loose. So we're gonna do a little shave for the back of the scalp here, right where our donor is gonna be, where we can extract the grafts. And so that's gonna be along the back here. So you'll see us shaving that area. And this is a bit unique in that when we have smaller hair, this is a smaller hair transplant, right? This is not like thousands of grafts. So when we have a situation like this, and it's a fairly discrete region, what we try to do is actually make the recipient sites first, so that when we go to the donor, we know exactly how many grafts we need. It's different from working on a very broad area, where we have a good sense roughly of how many grafts we can fit into the space. Since this is very discrete, I'd rather make all of my sites first. And one question that comes up is, well, how do you know the sites that you're going to make in terms of size if you don't yet have the grafts, which is a good question. And it's based on our experience of the hair caliber and what we expect to work in that region. So that's based on experience. But usually how we do it when we have a bigger procedure that involves a broader zone is we actually will harvest all the grafts that we've agreed on with the patient in advance. And then once we have the grafts, we make the sites and we try to match the site to the size of the graft itself. But in this situation, there is that small element of guesswork, but it's a highly educated guess, and that's I think in his best interest, so we don't go and harvest a lot more than what we need for this small space. Marco, any questions coming in?
How many grafts are you going to transplant?
So that's exactly what we're about to find out, because we're going to make all the sites first, and based on the number of sites, that's how we're going to decide how many grafts we need. What?
In this case, like medication, like finasteride will help or no?
Finasteride, no. I mean, finasteride here would only be for overall prevention, not for just the zone, because he's had this missing site for like his whole life. As far as number of grafts, just going back to that question, in my head I'm thinking about 200 to 300 grafts, but I want to confirm that, and so that's why we're going to make all the sites, and we're going to count the sites that we're making as we're making them, so that we have a fairly accurate number. Okay, there we go.
What is the way to control bleeding on hair transplant procedure?
I'll tell him in just 1 second.
Got it.
Hard to talk over the buzz. these loops are 2.5x. I'll mark those out on you.
This one.
These are 2.2.5x, and so these are my magnifiers when I'm working on the recipient area. When I'm harvesting, you'll see me switch over to 3.5x. So higher magnification for harvesting the grafts, lower magnification for making recipient sites. That's just my preference. With a lower magnification, you see a broader field. You actually get to see more of an area. And I like that when I'm making sites, just from the artistic element of it. When you're harvesting, it's a little less artistic, and it's a little bit more technical, in a way. So I like the higher mag to actually see the way that the hairs are exiting because you're trying to harvest them out. So that's just the way that I do it. So you'll see me switch these out once we're doing the donor area. So what was the question?
How do you control bleeding?
Oh, bleeding, we have epinephrine in the different solutions. So we use two different solutions. One is just lidocaine with epinephrine, basically straight out of the bottle. And the other one we make our own like custom mix. And it has like very concentrated epinephrine, and that helps control things as far as bleeding. So let's make sure we have where to mess in and everything.
That's over there.
Yeah. What about it?
For the tumescent roll, let's add the 20 early. You know what I mean? Because we're going to start at the sides. So we're going to add the extra 20. Sure. For recipient areas, we generally dilute things. Marco, I'm good on the camera?
You're good.
Oh, okay. Yeah, we generally will dilute the our tumescent mix, that second mix that I was talking about, with a little extra saline, so that the overall concentration of epi does go down a little bit. We don't want to go too crazy with the high concentration of epinephrine, because there could be some ill effect on the grafts if it's too high, because it constricts all the blood vessels, and at the end of the day we want the grafts to survive. So there's a balance between going too high on the epinephrine concentration that you're hurting the grafts, and then too low on the concentration where you have a lot of excessive bleeding. Keep in mind that bleeding during hair transplant is highly variable, so it depends on many factors. Some of it is the mix that we use. Some of it is the patient's genetics and how thin the blood is. And also, of course, like if they're on any medications or sometimes certain foods, caffeine, different things can thin the blood and create a bit more of an ooze. So lots of variables. We have a whole sheet that we give patients in advance of things they should not do. Did you review that one?
Yes.
Okay, awesome. You're good. So that's always helpful, but of course, not everyone reads it, and so we just have to deal with it. But yes, the main thing is going to be the epinephrine in the mix that helps control bleeding. Well, let's extend out the legs. We're going to start on his back.
On this side.
Over here, will it be okay?
On this side.
Will it be okay?
I think so. I think you're okay. Yeah, we can always slide things forward.
If that spot's yes.
Yeah.
I just don't wanna.
Do you need to use the restroom then, or you're okay?
On that, thank you.
Now slide everything forward.
Well done.
Is that all? Is that
Yep.
good?
That's good.
Okay, so good. So on the side. So you're gonna go onto your right side.
Right side.
So we have the exposure to the area.
Sure.
Okay, cool. So come on over here and try to make yourself comfortable. Don't put too much pressure on there first, yeah, just because sometimes it can be a little. Okay, try to support you.
Put this in between the legs.
We're gonna adjust that.
Is your neck okay?
Yes. Yeah.
sitting here actually.
Yeah. You wanna stand or you want an extra chair back here? Your head okay?
That's good.
Okay, we got some gloves.
Yes, doc. They're right here.
Really good?
Yep.
Oh, nice. Looks pretty good.
Yeah.
So I got the numbing, okay? So you can do this a little bit. You ready? Ready?
Right.
So this is the start of the local anesthetic here. This is our more concentrated lidocaine, so that the anesthetic starts working quicker. The tumescent mix has marcaine, which takes longer to start working, but it actually lasts longer. Lidocaine has a quicker onset and doesn't last as long, so they are fairly complementary to one another. Jonathan, how are you doing? You feeling this?
Just a little bit, but a pinch.
Like a pinch?
Yeah.
Okay.
Well, no pain.
Not too bad?
Yes.
So Jonathan does have some Valium and Ambien on board, which, you know, helps calm the nerves, and he's already a pretty chill guy, so he probably didn't really even need it. But for some of our patients who come in, they're very anxious for surgery, so those pills help. And obviously the numbing helps a lot too. So you can see me just going around sequentially in a fairly controlled way. So he's already, and I'm going around the perimeter of this area, and then I'm going to go in with my tumescent mix to get the rest of it. Because we try to limit how much overall lidocaine we're using. You still feeling this?
Just
A little bit?
the pinches, yeah.
The temple tends to be a pretty sensitive area. Other zones like the back get numb a little bit quicker. This usually takes a little bit more effort to numb. But we're getting there. So we do this like perimeter block first. Good. Okay. So next we have a slightly bigger sized needle for the tumescent mix, and he's already pretty numb.
They can see the skin.
Oh, I
Yeah.
guess you do that one.
Oh, just
And in terms of disinfection, I've already wiped the area earlier before we even started with markings with some alcohol, so that helped start things up. After the medicine is all in, we're going to do some betadine, and that's going to further disinfect the zone. You feeling any of this?
No. No.
So he's already numb, but this helps us reduce the bleeding throughout the zone by adding this mixture. So it's not just for numbing. Any questions, Marco?
They're suggesting we put a GoPro on you next time.
Yeah, but you have to remember I'm going to be wearing loops and to actually do the work. So, and GoPro, I have a GoPro at home, but it's heavy. And, you know, at the end of the day, we have to do good work here.
And you lose the detail.
And we lose some detail. So,
Yeah.
I think they're seeing okay, right? Listen.
Yeah, I see it. Okay.
Yeah, they are. Now they're seeing through. You can see that now.
Any other questions?
They're kind of trying to between themselves.
Like, how's your day? Where are you from?
They're talking about finesse, right? Mostly.
Nice.
Once again, how many grafts?
Yeah, so I'm anticipating about maybe 300, 2 to 300, but we'll see. We'll see. I'm gonna make sites and we'll go from there. It should be good though. So I'll take some data. You got a red bit,
Mm-hmm.
maybe throw it over there.
Michael?
This is
Can you keep the right one?
Yes.
This is betadine. This is a disinfectant. And when we're putting this on, we want to make sure we don't rub off the markings, because that would be bad. So that's why I'm like dabbing it on. I'm not going crazy with the rubbing. How many people are with us, Marco?
172.
Okay, hi people. Good, so that's good. So now, give me just a wet one. Yeah.
Dr. Jerry, when you speak, if you can just speak more
Louder?
louder and more clear, yeah.
Oh, okay.
If that is possible.
Yeah, I do have my mask on, so that makes it.
Yeah. So
I'll take a dry one.
we're doing our best, but I don't know.
Dry one? What I was saying is, when we're putting on the betadine, we want to make sure that we don't erase our markings, because that would obviously, not be good. So that's why you see me being very careful with my movements. And this is just a moist gauze. So we're removing the betadine in part with the moist gauze.
They want to know if it's his first procedure.
Yes. Right, Jonathan?
Yes.
He's never had any type of hair transplant before.
Correct.
This is just an area that's been bare his whole life. He was born with this region that was just missing hair, which happens. It's not the most common thing, but it does occur. And what I was saying in the beginning for people who've missed the start of this is that sometimes people present with a spot that's missing like this from alopecia areata, which is, as you guys know, the condition that I have. I have a more aggressive form, but there are times when you have these little circular patches that are missing.
You can breathe.
Do this, watch, I'm sure.
How painful is the surgery? Good question.
Well, we can ask Jonathan how it's been for him so far. Actually, well, I'm thinking, let's get rid of that. It'll just give me a sense of where we're at. This is fun. But I appreciate it. Jonathan, how has it been in terms of pain so far?
Pain, if I have the skeleton, it will be like 0 because I haven't feel anything yet. It just, at the beginning, it was just pinch sensation, but other than that, nothing.
You're saying a 0 because he just felt a pinch when we started the numbing. But otherwise, I mean, once the area is totally numb now, so as I start working, he'll let me know if for some reason there's some sensation of pain. but really once you're numb, like you don't feel anything. So I know people worry a lot about pain during a hair transplant, but I think if you're using the right medications, if you're injecting the medication in the proper way, it really doesn't have to be too painful. One of the tricks is actually to not go too fast with the injection of the lidocaine, because most of the pain actually comes not from the actual needle being under the skin, but from the burning sensation of the lidocaine. So the slower you inject, the better it is. So some people think that as long as they get through it quickly, right, they're going to cause less pain, but that's not actually the case. So it's volume of injection, and it's also speed of injection that leads to more discomfort. So like I was saying earlier, I don't know if you guys heard, but these are 2.5x loops, and I like to use these for the sites. I find that it's better to see like a bigger picture than when I'm doing the back part, where I like higher magnification and higher mag, but a tighter field of view. So let's do some directions. Let's get a marking pen and just some regular gloves for me from now.
Large?
The medium. Yeah, just for directions first. Let's do this. Okay. So next step, and we're going very slow and sequential here, so we can show you guys the process. Normally there's a lot going on at once, and we're a little bit quicker with this whole thing, but we're not in a rush, and we're just going to show you guys how it's done. So the next step is to look at directionality. And so now that he's numb, I'm going to just mark the direction. Give me a gauze, please. Because the key with transplants to make things look natural is to create a regularity, but also have a direction that's similar to his existing. So I'm noticing that these hairs are pointed down in this direction. These are going this way. And you can see that they're fairly flat as they come off of the skin. So as they come out, they're fairly flat and they're pointed in this direction, and then as you get more down to this like posterior aspect, they start to actually go further back. So like as I have my magnifiers on, I can see these little fine hairs, and you can really start to see and appreciate the directions a little bit better. So I'm sorry, I'm going to block the view for a second.
You're not blocking it because it's come up, so you're good.
Oh, okay. Well, you agree with this? It starts to kind of swing around.
Yeah.
Ruel's my lead tech. He's got like over 20 years of experience. So what you'll see me do as I work is, I like to bounce ideas and thoughts off of, my trusted colleagues, because, I think when we work, it's good to get multiple opinions at times to make sure that, we're seeing things the right way, because at the end of the day, we want to try to create a great result for our patient. It's not about, stroking my ego. Okay. So, six. Alright, so we're going to switch over. I like these gloves for making sites. Keep in mind, this is like a sub-sterile procedure, and there have been actually research studies done on comparing using like sterile gloves versus using regular like clean gloves, and there's been no difference in terms of infection rates. And the reason, let me just put this on a different surface. And the reason is because infection rates are so low in general that it's very hard in a study to show any type of difference because we just almost never honestly see infections after these surgeries. So it's fine to use blue gloves. It doesn't have to be these like sterile gloves, but I personally just like the way they feel when I'm working and actually making sites and doing extractions. So that's mainly why I use them. Obviously for other surgeries that I do that are a little bit more sterile, we do that. But with scalp cases, we keep it, you know, it's just sub-sterile. Okay, so we're gonna start with, so okay, this is, I have to keep remembering to explain. So this is a recipient blade holder, and then the recipient blade is right here at the top. And there are different sizes, and we custom cut these depending on the size of the grafts that we know we're going to be working with. So this size is a 0.6 millimeter recipient blade site. This is a 0.6 millimeter recipient blade, and we like to use this at the hairline. As I work, you're going to see me trying to create some degree of irregularity and try to keep the grafts and the sites fairly close to one another. We're going to increase the size for the heavier grafts, and you'll see as we get the grafts out what I'm talking about. But for the heavier grafts, for the 2s, the 3s, the 4s, the thicker, the grafts with more hairs coming out of them, we need to increase the size of this blade. So we're going to use a 0.6 for the finer hairs at the hairline and a 0.8 millimeter for the heavier hairs. Okay, so that's what we have here. You're going to count?
Mm-hmm.
You okay over there? Well, you want to maybe come over here? Switch it.
You read me out?
Let's raise the table a little bit. Okay. Jonathan, so if you feel anything sharp, you let me know, okay? We'll add in more medicine. You should be fine, but maybe sometimes. Well, let me know if you see any changes, okay? It is fairly flat. It's not sharp. It's decent, but it's not like really sharp. Yeah, it's getting old. So sometimes some of these blades can be a little bit sharper than others, and that's a 6.
No, that's an 8. Okay, let me see.
So we're gonna just try a different one. Well,
6.
that's
That's a 7.
Close up or something, please. Get that. Hold on, just. Splash some. See them. So I just switched out to a different blade to see if this one's a little bit sharper. I could work with that one, but we like it sharp. I don't know what I want. Is it freshly cut?
Mm-hmm. On the new one?
It's not.
What do you think, Ulrich?
Stop the roux figure out. So we're gonna cut down a few more of these because for some reason in this batch we got some blades that just aren't sharp enough. They're okay, but I like them really sharp. So we're gonna cut new ones. So this is what surgery is all about. I think that's why this live I think is important, because I want people to realize that there's a lot of nuances that go into surgery. And you guys see all these different results and whatever, and we do showcases on our channel. People talk about different elements of surgery, but I think what you miss when you don't see an actual surgery is like all of this stuff, right? The stuff that goes on behind the scenes that is really important. And there's a lot of things that happen during a surgery that we're constantly making little adjustments, little changes, and that is part of the surgical process. I'm gonna try this last one I have in my batch to see if it's sharp enough. If not, we're just gonna wait for the next batch to arrive. There's something about these that just aren't moving properly. You have to count from around.
Yes. 5.
Could just be the skin in the area, but I think a bit sharper. Doing okay, Jonathan?
Yes.
No pain?
No.
So I'm trying to keep a fairly flat angle to match the exit angle of the hairs in the neighborhood. And now that I'm looking at this space more, we might end up doing more than 300. We'll see. I don't know. See what it comes out to. No pressure. Let's make them now. Oh, these are them. Where's the ethanol? Is there ethanol? Where's the force up? It's like 95, so. So the old one is on the border. Just maybe give it another minute or so. So it's so. So we're just soaking our blades in ethanol. Good, and just spray it down as well. What was your count on the left?
8.
Good. And Maria, what do we have total then?
We have 12.
You got it?
Mm-hmm.
Could just be the skin too in the area, It's better, for sure. Doing okay? Wipe it intermittently.
Okay.
Go through. Switch the arrows, yeah. Perfect. So sometimes it gets a little oozy, you just have to apply some pressure. Sometimes we inject more medicine. In this case, I'm just going to be patient here. Watch your finger. So I'm not just going in one straight line, I'm creating irregularity as I work. This part already has hair, so I don't have to go as dense. But we do want to blend in the transplants with the existing hair.
They're asking how long will the procedure take, roughly?
We'll see, about 4 hours, something like that. But with hair, I always tell people as long as it takes, well, actually with all surgery. But yeah, this is not a full day surgery. When we do like a bigger transplant with like 2,000 grafts, it takes all day. I'll take a look for the symbols. Can you see it well?
Yeah, I can see from the screen.
Oh.
It's bigger there.
What do you think? Look
That's
better?
really good.
How many?
53 so far.
Yeah, I did 2. Maybe add another one.
Yeah. It's bigger in the front.
No pain?
Okay.
It's probably go there, maybe one more here. It's good, right? Maybe one more here. Just for this corner, you know? And we have to get a couple extras from the back just to make sure we can add in, you know? Like if we need.
Mm.
So this again is like the artistic part of the whole surgery. And it's the design element too. So I'm following my original markings, but I'm still just looking at the pattern that I'm creating as I go and making adjustments. And you can see Maria is really helping me by giving me counter traction, because the temple is notoriously very mobile. So if she weren't doing this, like when you're working on the main like scalp area, it's less critical. When you're working on this very mobile portion, there's a lot of movement, so she's counterbalancing me with her hand, and that's super helpful. So I think it looks good, right? So do one more there. Did you go any tighter? Let's see. You can get any in between. It's tight.
It's tight now.
It's fairly good regularity. I can maybe go a little bit like, scatter it a little. Scatter. Good, okay. Alright, so let's do a little pressure in front. Got 8?
Mm-hmm.
You watch that down?
Yes.
Okay.
You okay?
Oh yes.
What's our count?
73 though.
Alright, so yeah, so that's 73, and we've just worked into the hairline, so I think we'll be closer to 4 or something. We'll see. Okay. So now I think I'm gonna start here, have a little bit of a start here, a bit of an easier visual.
Good.
Yeah, that's good. I think this area is just a little, we got the count going.
Mm-hmm.
Any other questions right now?
Yes. Dr. Gary, how long is the healing period, and how many percentage of the hair implants that will survive?
Well, most will survive, like 95% or so tend to survive in most, surgeries. Healing takes time. I mean, it's a gradual process. Takes about a year to see final results. Takes about 2 weeks for the little crusties to fall off. About 4 months for the hair to start growing in. So it's all like a gradual process. The worst of it is the first week with swelling and things like that. But there's healing that goes on beyond that. What else? Anything else?
Do women get this done? Not for hair loss, but to augment naturally thin areas at the temple, or adding a widow's peak?
Yes, they do. That's helpful, Maria, thank you.
No problem, Wendy's.
How many millimeters deep do the grafts go in?
About 4 to 5. Would you say it, Ruel, or?
Yeah, I think the most would be 8.
Yeah, up to maybe 8.
For the really long grafts.
Depends on the length of grafts, but we make our blades long enough to accommodate most.
Has anyone ever had hair transplanted to an odd location, such as their nose?
No, but I've done pubic hair transplants, which is a little odd. But, it's a thing. Did they hear that? Pubic hair.
Is it possible to hit a big vein?
Yes. Short answer. But keep in mind we're going fairly superficial. I'm not going too deep. This is also why when you guys say, oh, he does other procedures on the face, he doesn't just do hair. Yeah, but then I'm not scared of veins that live beneath because I know where the veins are and what to do if we get into them. Because, you know.
Dr. Gary, is there a specific timeline from harvesting to implantation?
You know, the quicker you can get the hairs back in, the better, but realize that oftentimes these surgeries run the full day. So it can be hours before you can get the hair back in sometimes, and they still survive fine.
Will we get to see his results in 6 months' time?
Probably.
Are there any new surgical or non-surgical developments in the work to increase hair density in people with genetically less hair to begin with?
Give me a second.
Sorry.
Come back to here just because it's
Okay.
a little tricky. Doing fine?
Yes.
Usually as we work, it's like, this part I'm always very focused on, because obviously this is critical, but most of the surgery, we're actually like typically talking to the patient, having a pretty good time, so we're just being extra quiet, because we're on video, but usually my team is not mute, but you know, we're trying to just be respectful, work and talk to you guys. Are we at 100 yet?
156 though.
Oh. If you need a break, we're gonna switch off. Yeah. As I work, I'm looking at the arrows, but I'm also looking at the hairs in the neighborhood to make sure I'm still following the natural directionality of the hairs. See, we're already at 200, so I'm guessing we're probably going to go closer to 4 for our total, now that we're seeing how much this area is taking. Another gauze, please. What was the question about all the developments? What was that question? Okay.
It's gone now.
I mean, it's gone. How could the question be gone?
There have been too many questions since then, or too many
Twenty.
chats.
Question.
Do certain hair types slash races have more successful slash difficulties? More success slash difficulties?
No, I mean for every race you sort of make adjustments to the hair type. But if you do it right, I mean,
Oh, sorry. So
it tends to be successful.
here's the one. Here's the one from before. Are there any new surgical or non-surgical works in development for people with genetically less hair to begin with?
Genetically less hair. I mean, there's the medical therapy side of it, but I mean, there's nothing too novel, unfortunately. But in terms of medical therapy, you know, there's a lot that we talk about on the channel. I'll go a little less dense here.
Very good for
What
another
else?
question.
Yeah, go ahead.
Can you get a hair transplant if you have hemophilia?
Yes, we just need clearance for it, but usually yes. You need clearance from your hematologist.
Speaking of medical therapy, how long can you go without minoxidil?
I mean, it's something you should be doing all the time, so you can take like a week break or something, but after a while, after like, you know, a few weeks, you start to lose the gains. Usually, I would say it's probably closer to like a few months. You don't want to take big breaks.
I'd love to see you do a live rhinoplasty as I had this surgery done.
Yeah, I mean, for now, we're focused on local procedures as far as live, and I really want to focus on the hair procedures for this. I think it's a little bit more amenable because patients are awake, you know, they're also able to talk and say stuff, so it's a little less, I don't know, like intrusive it feels than doing something when someone really can't say anything and they're being recorded live. You know, it's just a little bit trickier to do it that way, I think, from like a patient perspective. So I don't have plans to do any rhinoplasty live for now.
What has been the longest surgery that you have done so far, time-wise?
I mean, hair surgery always takes a long time, but if you're talking about like a surgery where I'm literally sitting there just doing the whole thing the entire time by myself, with, you know, like in the OR, like a facelift combination with other things can take a long time, like a lip lift, facelift, lip lift, eyelid surgery, brow lift, stuff like that can drag on.
Should I ask more or?
Give me a sec. So let's come back to here. Let's go back through. What's the number?
283.
let's, Mary, can you switch with her well?
Yep.
Awesome job, thank you.
No problem.
Let's, I'm gonna grab a forceps, just add some more. Doing okay? So now I've laid down the initial pattern, and what we're gonna do is basically fill in the blanks. What's up?
Got it.
Good?
Yeah.
So, yeah, does anyone have any questions for Jonathan as far as his experience so far, anything like that? Marco, do you see? Or?
Not yet.
Okay.
There's st-
They just want to interrogate me.
only stuff about pain, like if it was painful.
Oh, okay. No, he's doing good.
Number?
What was the number? I think it's 283. Yeah.
When did he decide to do the procedure?
When? Jonathan, when did you decide that you were gonna get this done?
Well, I was doing my master's, so yeah, I got an internship with Bloomberg and the CFO.
A little louder, It's hard to.
Yeah, so the CFO of Bloomberg here in Lexington Avenue, he's a huge fan of your videos.
The CFO of Bloomberg
Yes.
watches my stuff?
Yes.
Damn!
And I did an internship with him, and
So cool.
he was like, "Hey, you gotta try that guy. You gotta."
Yo, CFO of Bloomberg, if you're listening,
Yeah.
thanks for referring Jonathan.
And then
That's crazy.
you know, I decided to do a research.
Thank you so
You're the
much
right
for
person.
trusting us. Yeah. You feel okay? Comfortable?
Do you recommend minoxidil after the hair transplant?
Not for everybody. Depends on the situation. If you have a lot of miniaturized hairs, just diffuse thinning, it's just the thing is it's starting to get some. But yeah, I agree with you. If there's like miniaturization, like for Jonathan's case, minoxidil is not going to do anything for this situation. There are times when medical therapy is the answer. There are times when surgery is the answer. And more often, there's a time when both are necessary. It depends on the clinical situation.
So someone said my hair is thinning. What can I do to make them not fall?
One sec. Well, that's a very broad question. I mean, there's a lot of elements to that, and we always welcome people to reach out to us for a consultation. But hair thinning is very common. You can start with our medical therapy videos to get some information, but as far as like your specific situation, that's where the consultation comes in.
How old are you, Jonathan?
27.
What sensations do you feel, Jonathan, as this is happening?
To be honest, nothing. Like I don't feel any pain or any sensation.
It's good here, so it won't be too dense.
Mm-hmm.
The other side's not super dense, and in this region.
Can you use hair from other parts of your body?
You can, but the problem is that they generally don't grow in as well. So, like, that's why earlier when I said 95%, for the scalp hair, that percentage goes down as you go to if you go to harvest from other parts of the body. So, we could technically do it, but that doesn't mean that it's a smart thing to do in most cases. Sometimes we'll do neck hair for men who have run out of a scalp donor as another donor supply, and sometimes chest, but usually not other parts. You can bring scalp hair to other areas, but you shouldn't really harvest from too many other areas. Right here. So at this point we're just filling in the blanks, trying to increase the density. Because I think, yeah, this is pretty good here.
Mm-hmm.
Alright, Marco, what else you got?
What are the do's and don'ts for the patient after the surgery?
The biggest thing I tell people is, like, don't rub the grafts off. It sounds like obvious, but it's not always that obvious, and so that is the number one thing, because, like, every doctor has, like, so many instructions and all these things, and I do too, but at the end of the day, most of it doesn't matter a ton, meaning that the hair will likely grow anyway. But what matters is if, like, in the first few days before the hairs get anchored in, if you just happen to brush along it with your hand, with an article of clothing, you can just disrupt the grafts, and you lose them forever. So that's the worst thing that could happen. So you just do everything to prevent that from happening.
Will we be doing more of these in the future? Is the question.
We'll see how this goes.
357.
I don't see why not, but if you guys like it, and if we get other patients willing to share their story, I think we will.
Do men do beard transplants?
Yes. What else? What else you got? So Ruel's also helping me here. He's pulling, he's searching along with me to see where else we can add in some density.
Any advice for women who want to have hair transplant?
Yeah, I mean, it depends on the scenario, but women can be good candidates for hair transplants too. The most common scenario, I would say, for women is hairline lowering. We do quite a bit of that. We did it yesterday for actually a woman who transitioned and wanted to look more feminine, and so we rounded out her hairline quite nicely. She was very happy. Right here feels like it's a little it's tight.
Okay.
368.
Yeah, 360. But when you release it, it's
Yeah.
already like
You're saying
good already.
dense.
Yeah, only when we spread it like that.
Yeah, it's true. But it's always like these little spots that end up showing up. So. We should probably look at the other side just to see.
70. And this is naturally sparse too.
I know. Yeah, we don't gonna go too crazy with that.
When can he start using shampoo on his hair?
Right here, one second.
71.
Shampoo is gonna be in 2 days, but it's gonna be done carefully. These are all angled fairly down. I think we should give him the 6 days. Yeah. No bucket water. I agree. So this is again, it's a little bit of a unique situation, but he's gonna try to avoid pouring water over the head for until day 6, and then he'll be able to shower. But there's gonna be a spray we give him that he's gonna use a spray on the grafts. Because it's mainly because of the angulation, since all these hairs are angled down. You start pouring a lot of water and getting everything wet, there's a chance that the grafts could slide out. When we do scalp, it's a little bit more forgiving because the hairs aren't angled down. But as you can see, we're following the natural angulation of the hairs, so that increases the risk of them being dislodged if you start using a lot of water too soon.
74.
But you can see how important this counter traction is for me. Without it, it would be a big challenge to do this procedure.
Does he need to wear a cap or a hat when outdoors?
Yes, he will, but not initially. Initially, we actually go capless because we don't want the grafts to get dislodged. So that's what we ideally will recommend to people. And then, and then eventually you're going to want to protect it from the sun. So then that's when the caps start. What do you think, Earl? Anything else you see?
381.
381.
Yeah, we'll get 400 and then.
Yeah, we can always add more.
Yeah, the remaining 20 we can assist.
Do you think we'll get singles though? And yeah, we'll see, I guess. So that's 381, right? Let's just look at the other side just for good measure.
Okay. Turn it onto your back now, please.
You want me to put the
Like
pillow
this.
underneath your legs? Under here? Is that okay?
Yep.
That's okay. I mean, obviously
you.
it's swollen
No
enough. But pretty good. What do you think, Ron? Pretty good. I mean, this is not like
Crazy.
I think it's good.
Yeah, I think it's much.
Still don't know if we need 380 on the donor because if we're gonna have to break some down to singles.
Oh,
Because how many singles do we have? Like
73.
73. I guess we'll see what's coming out. Okay. So you guys just make sure you have those numbers. Like just write them down.
Yeah, I have it here.
Okay. You have the
73
total and the
singles.
singles. Let's write the total.
381.
381. Yeah. Okay. All right. We're good for now, right?
Can you
Good.
fly immediately after a hair transplant?
Can you fly?
Yes.
We like patients to stick around town for at least a day. Usually a few days is best. You don't want to fly the same day.
we can
Okay.
flip him over.
Yeah. So now that we're done with that part, well, let's tape something over here, like a little top-punch. Telephone tape, guys, for the area. All right. So we're pretty much doing okay.
Yeah, going fine.
Pretty much done with what's the
Thank you.
pretty much
They don't
done
have
with
the small one?
site making. Let me see again. Is the
No?
AC
Okay.
working? It is? Okay. You're doing great so far. Oh, when I look at it from here, there's a little bit of a scoop up. See what I'm talking about? Now that we've released it. But it's also just the overall design. Maybe like
Just straighten that?
not straight.
Just like curving like that?
Yeah, you're right. Looks good. Give me like a moist. So like the area with the moist, I should look at it. Scoops up a tiny bit. Yeah, actually I like that.
Mm-hmm.
That's good. Give me a mirror, Jeff. Show you sort of the pattern. Okay. Obviously this is without the hair, but just so you can see the pattern that we're working. What do you think?
Looks good.
Yeah, trying to create some irregularity. It's okay. Obviously it's swollen up right now, but I think that's the zone. We might add in a little bit here and there, but it's mostly done.
Looks good.
Cool. That's good.
Jim, take that there.
Great. Great. Yeah, that, and then just let's do the flip, and
No
I'll be
problem.
back. Okay. So now we're gonna flip over, and we're gonna start to harvest from the back to get the grafts that we need. Are we okay, Marco?
If
Say
you
it
want
again.
to talk into this one, you can.
Oh, yeah, so I'm gonna go change my magnifiers to the higher magnification, and we're gonna flip over and we're gonna harvest the grafts that we need from the back, now that we know the number that we need. So again, this is why we started with the number, because originally I was thinking maybe 200 to 300, and now we're essentially gonna be harvesting closer to 400, because that's what the area truly needed. So this is another reminder that sometimes for these smaller procedures where you have a concentrated zone that's a little bit unique in its architecture, it's sometimes better to do your sites first, then get the hairs from the back. Any other questions right now?
Looking for that.
I'll just read them out if it seems appropriate.
Okay, so now
Does
we're
John
gonna flip
have-
over.
Yes.
And just put one
Okay,
to
yeah,
the belly
it's not
button.
relevant.
We.
Do you want the pillow underneath your legs again?
Oh yes.
Or you want it under your belly?
On the
Under your belly.
no.
Can I have the black one that's on the corner,
Yeah.
please? No, on the corner, right there on the
There?
side. Mm-hmm. Thank you so much. Lift your legs for me.
Oh.
Mm-hmm. You can lift them up.
Oh. No.
Mm-hmm. Is that okay there?
Yeah. That's
Okay.
Where first? What will you? Here?
No, sir. Well, you wanna put a towel or, oh, sorry. Chuck on here. Towel. Grab this one. Did you check the autoclave?
Yes. Okay.
Check the autoclave. Did you guys take everything out?
I think I'll everything now.
What do you mean?
The forceps? I had a bunch yesterday.
We also heard this yesterday.
Do you think it could be in this room? You're good. I'm just making sure that the autoclave is empty.
Just let me know whenever I need to move something.
No
I'll go
problem.
right away.
Are you comfortable there? You look a bit uncomfortable. You
Oh,
can let your
this is
arms
the chair.
down.
Oh, oh.
Yeah, on the side, so that way you don't have to be. Is that okay?
Yeah, that's much better. Oh yes. Perfect.
Better?
Yes. Thank you.
Jonathan, they're praising you in the chat. They're saying you're the GOAT, the greatest of all time.
Jonathan, they're saying thank you for sharing the surgery with us.
Oh, that's sweet.
One.
You comfortable, Jonathan?
Yes.
You can also put your arms behind, like on the side, if you wish, or you can dangle it, whatever honestly you're comfortable with. Either way, so. Alright. Let's hit that light. Well, that light might be tough. Well, I'll be fine with my light, so that it might be tough to have to bring that in. So for now, maybe just on my light.
Yeah.
Oh, skincare. No, I'm just kidding. It's coming. Once we make it skincare.
Okay, can you step out for a second, please?
Okay, so now we're ready to extract some grafts. Yeah, I can mark the bottom part of it. You can maybe turn this on, but then like keep it out there. Can you see?
Just a second. Let's switch it on. Yep, they can see.
No, no. Like that one. Okay, so now we're going to start with the numbing. for the back, okay? You ready?
Right.
Okay. So what we do here is we numb along the base first with the 2% lidocaine. So okay, let's do the questions. Just start calling them out.
Do these graft procedures work for people who have hair loss due to burns or deep scarring of the scalp?
Yes, but the worse the scar is and the less of a blood supply that it has, the less likely the grafts will take. So just something to keep in mind. So it's not like going to grow necessarily at that 95% survival rate. It's going to be lower than that. And how much lower depends on how bad the scar is. If it's a scar that has almost no life in it, like there's no blood supply, then it's low likelihood of growth. But most scars still have decent blood supply beneath them, so we can usually make something happen.
Can people with autoimmune diseases do any kind of surgery, or is there a different protocol?
Yeah, I mean, it depends on the type of autoimmune disease, but yeah, I mean, unless you have an alopecia areata, even then you can sometimes transplant. So yeah, it depends on the condition, and we usually require a little bit more than 2%. We usually require clearance from the primary treating doctor. Jonathan, how's it going?
I'm good.
How does this part compare to the front in terms of numbing?
Oh, I feel them more.
You feel this more?
Yes.
Got it. Interesting. A lot of our patients complain more about the front, but everyone's got a different pattern of sensory nerves. Some people have more in the back, some people have more in the front. So just, depends on the person. So he feels this a little bit more, but it should all be numb pretty soon. But again, this isn't the type of pain that you're like jumping out of your seat
Oh, no.
in pain. But it is kind of scary for a lot of patients, but the purpose of this live is just to show you that it's really not bad. Most people when they leave, especially at the end of like a long day, they're happy it's over, but like they kind of enjoyed the day. We have nice conversations and things usually flow well. So it's not as scary as it might initially seem. So again, this is the mix that we've made. This is our custom mix. And that's what's going in now. Again, I'm starting low because I know that the nerves are coming in from the back here, lower down. So I'm getting those nerves and then I'm coming up from there.
Do you need multiple surgeries, or is this a one-time procedure?
It's a good question. So with hair transplants, oftentimes we're not able to match original density in a place that, is right next to a zone that normally would have very high density. So it's common for people to come back and want like some fill-in procedures, or if we're unable to work on a very large zone because of just the total number of grafts, they might come in for a secondary surgery for the other location that we couldn't work on initially. In this situation, I'm hoping that one surgery will be enough for Jonathan, in the sense that when you look at the density of the temple, the part that we worked on his left side compared to his right side, it's not super dense. So I think we're able to create a similar density where he hopefully won't need another surgery. So every case is different, but there are plenty of scenarios where people want more. Like everything still worked out. It wasn't like it was a failed surgery, but people just want more grafts. And as you saw me working, there is a limit to how close we can put the grafts. I mean, there's like a physical limit. We have to leave healthy skin in between all the sites that I made in order for the grafts to actually survive and for the skin in the area to survive. If you just poke through everywhere, then you'll have a reduced viability of your skin and the grafts won't make it. So you can't really always pack in the grafts at the same density of original, hair, but we can typically come close. What else?
Are you injecting adrenaline with the anesthetic?
Yes, there is epinephrine in both of our mixes. The one that I initially started with, and then in this one as well, there's epinephrine.
Do you have to take anything to maintain the hair once this is done?
Not in his case, but in people who have signs of androgenic alopecia, for many of them we do recommend some medical therapy. Again, it depends on the reason for the hair loss. Not everyone has the same reason for hair loss.
Are you involved in any research?
I've done some studies like related to hair, and obviously more stuff in the past related to other things like facial plastics and head and neck surgery, which is like my background. These days, honestly, like at the current time, no, because I'm very busy clinically, and we have a lot going on with YouTube and a few other projects. Like we're making a scar gel, and that's, like everything takes time. So I just don't have time right now for research, but hopefully in the future I'll make more time for it. That's the last one. So how is it feeling now, Jonathan? Do you still feel any like poking or anything like that?
Just the pinch, but no pain.
Okay. Is better than when we started?
Yes.
Okay.
How long does it take for the full results to show up?
About a year. Usually a little sooner, but we just typically say a year.
Do you always have to shave the donor area, or could you still harvest as long as you have the root of the hair?
Yeah, so usually we're shaving for FUE, and the reason is because we have a more wide open area, and it's easier for us to work around and get the best grafts. But there are situations where we'll do a partial shave or a no shave. So there are times when we'll do less shaving. Like even in his case, like we didn't have to shave all the way around because this is a smaller number of grafts than a lot of our cases. But yeah, for like no shave technique, we'll only do it on like a limited sized case, and usually hair that's like not curly, and there has to be a very special request for that, and it's usually so it just depends on a lot of variables, but we try for FUE to usually do a shave technique. We find that it's a more even distribution of the harvest, which is important. It's harder to do that when you're not shaving.
If you want to look into this camera.
Yeah.
Can androgenic alopecia affect the grafts in the future?
Is the AC on, Malcolm?
Yep.
Can androgenic alopecia affect what?
The grafts in the future.
Yeah, I mean in his case, so yeah, in any case, androgenic alopecia can affect can cause further hair loss for him included. If we see signs of that, we might then put him on a regimen. But in the meantime, these grafts that we're harvesting are more resistant to DHT, and what?
If you can go to your left side, just a bit, so they can see the monitor as well.
Oh, yeah. Because of that, these hairs will actually be a lot more resistant to further loss. But of course, he's not necessarily immune to androgenic alopecia. So if we see signs of that, we'll put him on a protocol.
Is it possible to damage the hair follicles when you're injecting with the needle?
Not really, no. No. I've never heard of anything like that. And then some people ask about scarring from the needle, but it's such a small little needle, it doesn't really lead to scarring. We use a 30 gauge needle, just like what people use for insulin injections.
When can he go back to work?
Depends on the type of work. He should be fine in about a week. But, if people have a very, very physical job, we'll ask them to take a little bit more time off. And some people work in dirty work environments, like, mining or something like that, where it's better for them to take even more time off. If we have people who are swim instructors, then they should take 3 weeks off. You know, so it just depends on the type of job. But for most like desk type jobs, a week is usually sufficient.
Is hair transplant worth for people with alopecia areata?
So for alopecia areata, I mean, obviously in the condition like that I have, which is the subtype universalis, there's no hair to harvest, so you can't physically do the transplant. For like a specific spot of areata, like let's say Jonathan, instead of having the spot from birth, had a spot of alopecia areata, we want it to be stable for years before we consider a transplant, and it's always going to be at risk of having the body like attack that site again and losing that hair that we transplanted. So a bit risky, but we will sometimes do that if someone's had this, like a stable spot for many years. Not like a new spot that just opened up. That's not a situation where we would do a hair transplant.
How do you avoid graft loss when you're sleeping?
Well, you have to sleep on your back. You have to sleep upright, elevated to a degree. Neck pillows can help. And you just want to surround yourself with pillows and avoid rolling, and that can help reduce the risk. Yeah. So now we did a little bit of trimming of the hair so that, you know, it's fairly short. It helps us with our FUE extraction, and we're cleaning the area with betadine just like we did the front. And yeah, you good, Mark? You can still hear me, right?
Yeah.
Okay. So yeah, so we are rolling through, and so then I'm going to start with the extractions shortly. Ruel is also expert extractor, but you know I'm gonna get the process going. This is, as you can tell, this is like even for a smaller procedure, it's a fairly involved surgery that takes a lot of people, takes a lot of assistance, and you can't have the doctor just doing every little, like you don't want the doctor doing every part of the surgery because they're going to get tired and they're not going to be able to perform at their peak for like the entire day or however long a procedure can take. So you want to have a good team on hand, and the doctor then has to delegate different tasks depending on the situation. So, you know, I think one area, one type of, one part of the process that I don't delegate out ever is the site making, which is what we did for this surgery in the beginning of the procedure. So that, to me, is like really the most critical part of the surgery. It sets the stage for everything. But it's very important, though, to also be involved and to oversee the rest of the process. Do you want to pass through?
Yeah.
Alright.
Can you use minoxidil with PRP?
Minoxidil with PRP?
Yes.
Yes, you can. Good.
Can temporary minoxidil help with minor shedding due to the stressful lifestyle?
Yeah, but keep in mind, minoxidil can cause its own shed in about like 15% of patients. So it might actually make things worse before it makes it better. There's just something important to keep in mind. You can just tell them what you need, Marco.
Yeah, here, I'll just pass them.
Oh, here, you grab that. Good enough? Switch. Watch your head on that camera.
Which is most effective for preventing hair loss, finasteride or the dutasteride?
Dutasteride is going to be more powerful, but it's also going to increase your risk of side effects. So, you know, more risk, more reward.
Lift your head, tuck your chin to your chest.
If you feel any of this as we start working, The other thing, just let me know, okay?
Sure.
We'll add it to medicine. I don't want you to keep it to yourself. And make sure if you need to like get up, just let us know, okay?
Okay.
Is this a 1.0?
Yeah.
So this here is a, can they see, Marco?
Yep.
This here is a 1.0 punch. So there's different size punches, and we've selected a 1.0 because we feel that that's going to be the best possible punch for him. I know, but there's, give me an alcohol, please. Open it up.
Does finasteride or durasteride affect fertility in men?
Dutasteride
Yes.
or finasteride?
Mm-hmm.
It can reduce it can reduce your libido and fertility to a degree, but not necessarily your fertility, but it can definitely reduce libido and sexual drive, and can cause some erectile dysfunction. So it's not without its risks. All right, let's pause the questions. Just a little bit of a lean here. I don't want to go that way. This is straight here. Can you see okay, Mark?
Yep.
Okay, so you can see there's a curvature to his grafts, but so far they're coming out okay. So now we just have to keep repeating that process. Jonathan, any pain at all?
No.
Well, then just watch my spacings, okay?
Mm-hmm.
Okay, need to go wrong. Sometimes as we punch, the grafts can get stuck in our device. So we pull those out like that. Jumping as well. Let's check this one. I think maybe we start back here.
Yeah.
Just grab these just harvest them out. Just have them go, we'll start. Probably have them turn. Yeah, Ken from the right. Okay. It's too hot, right? Yeah. I don't know if it's all the people or if it's the AC not working. Marco, how's the AC feel behind you?
It feels cold. I'm cold here.
Oh, really?
Yeah.
So it's just the heat of everything, the electronics and such. This is a lot of noise, so I'll just do it
Mhm.
lower. Let's check that out. So this is the FUE method of extraction as opposed to FUT. There might be one we can salvage here. Space enough to so.
Mm-hmm.
It's starting to kind of curve down a little bit. Let's tuck the chin to the chest a little bit more.
Lift your head, please. I'm tucking your chin to your chest more.
Yeah. See, as he did that maneuver, I have a better angle. You know.
When you're talking about?
Our count so far is 29.
You good?
Mm-hmm.
What questions do you have?
Okay.
Why don't you use an implanter pen?
Well, first of all, implanter pens are not for the donor area. I didn't train with that, and I prefer to use recipient site blades. Just my preference. I feel like I can get better angles with the blade, and yeah, I just like them more.
Will the harvested spots grow new hair strands in the same empty cavity?
Nope. You get little dot scars with FUE.
Will this procedure damage the donor area since follicles is included in extraction?
Well, not really damage, but you definitely get little scars where the hair used to be. I mean, I wouldn't call that damage, because they're being used for the front.
I don't understand how there's little to no scarring for an FUE transplant when you take out so many hairs. Wouldn't there be a lot of bald spots?
These holes heal into these little tiny scars, so it's very imperceptible, especially when you do a small procedure.
Is it possible to get a hair transplant even if you have no hair loss?
Why would you get a hair transplant then? Why would you get a hair transplant if you don't have hair loss?
Make him bushy.
We don't like do transplants where we just thicken things just to thicken things. That's not really proper use of surgery.
Is this the smallest an FUE scar can be?
No, I mean, you can use a smaller punch than this, but the problem is you're not going to get good grafts, and then they're not going to do well in the new location. So, you know, you have to go, you can go as small as you want, as long as you're getting good grafts. So you can look at these grafts that we have here. There's not a whole lot of meat on them, but there's enough meat that it will survive and do well. If you go much skinnier, it's not going to be as good.
After taking the hair follicle in that area, does the hair grow right back?
No, it leaves a little scar.
Can you have a hair transplant to reduce your forehead?
Yes. With caveats. Let's do a moist one. The caveat is if you're... How are we doing on count? Because I don't want to just focus on this.
That's Second then.
I think we're good, Roll.
Yeah, this is good.
200.
My count is already like 100.
Give me another spray here. So, okay, that's. We can always come back through, yeah. I just want to distribute it. If you're like a young male patient, we're not going to reduce your forehead because the risk of further recession is too high. But for women, and for older men, it can be a possibility.
Is it worth getting a hair transplant before 1 year of assessing whether finasteride is working?
Yeah, you don't have to wait a year. You can do 6 months.
What can the patient expect to feel in the next few days? Will he feel any migraines or itching?
I mean, it's gonna feel a little bit sore, but it's not bad. Not too bad. Maybe Jonathan can send us some like videos or something about his healing.
Yeah.
Maybe we can post them.
Does a hair follicle have a lifespan after being taken out of the donor area?
Marco, sorry, just take note of that.
Mm-hmm.
So we can post for people.
Yep.
Sorry, what's the question?
Does a hair follicle have a lifespan after being taken out of the donor area?
Yeah, about like, what do you think, about 48 hours?
They say 72 and they say
Yeah, about 72 hours if it's like in the refrigerator and in the right solution.
Can I wear my hair in a man bun after a hair transplant surgery or will the hair fall out again?
Well, we don't recommend tight hairstyles. It's usually not good for hair.
Are you good for more questions or?
No, hold on.
Okay.
So if they're changing direction or something here. Clean this one for me. The last few. Just a little bit. And then tuck the chin in a little bit more. That's good, thank you. Down here. 2?
Mm-hmm.
Open at about 200. Or doesn't it? Go to the other side now. More questions?
Okay. How do you know how far to push that instrument into the scalp to extract the follicle?
Honestly, it's a feeling. It's a feeling. If you push too far, you're going to bury the graft. If you don't do it deep enough, you're not going to be able to pull the graft out safely. Meaning you'll just essentially just like cap it. You'll just pull some skin. You won't pull it out with the whole bulb, the whole follicular unit. We want to pull it out with the unit. It's a feeling, and it's different for every person. It has to do with the way the scalp thickness is, the way the tissues move. There's a lot of elements to this. So I'm changing, you can see my angle is changing, my direction is changing to accommodate the follicle. You don't just like go straight down. I mean, you have to see the curvature. There's lots of different things. That's why I'm going nice and slow, because you can get 400 grafts with 400 holes, or you can get 400 grafts with 800 holes. Because if you're screwing up every follicle that you're punching, you're going to end up doing 2x or 3x the number of holes.
144, 19.
Plus, I got 25 there, so 169.
Okay.
One more, 170.
What else, guys?
Okay. Could you fix a ruined hairline in the front by constantly plucking out a widow's peak without a transplant if you have no hair loss?
What? What's the question?
Could you fix a ruined hairline in the front by constantly plucking out a widow's peak?
I don't really. I'd have to look at pictures. I don't know what like a ruined hairline. I don't know what they mean. How is it ruined?
Maybe they put the bigger drops in the front. Like they put the
Can they pluck out the widow's peak? I mean, you could pluck it out, but I don't know if it's going to fix it.
Are all follicles taken out viable to transplant to the new area, or does the follicle have to meet any specific criteria to be transplanted?
Or well, answer that one for me.
And the follicle needs to be healthy. It has to have all the tissues around, including all the appendages, and it shouldn't be so skinny that all the appendages will be lost, then it will just be a waste.
Marco, could you take the camera and show them through the microscope, maybe?
I actually did show that for a couple when you were taking off.
Okay, so, but maybe do that and have Maria show them.
We'll do the
Is a person with alopecia areata mild candidate for hair transplant?
I feel like we've already covered that. Grab this one. Yeah, we've covered that earlier.
Is folliculitis normal post-surgery?
Folliculitis?
Folliculitis, yes.
It can happen. Yeah, I mean, it's fairly normal. Changes down a little bit more.
it's curving perpendicular. Right.
Given how important
And Maria, did you talk to them about? Can you tell them about like what they're seeing
Okay.
in there? Thank you.
No problem.
Like what are you
Here.
what are you looking at when you're judging?
So over here, you're gonna look for the bulbs that are on the very bottom, which represents what is gonna be growing. So here, this bulb over here has 4. A group, oh sorry, do you wanna put it here? So this graft right here has a grouping of 4 hairs. It has 4 little bulbs, so that's a 4-hair graft. This one is with 2 bulbs, so this one would be considered a 2-hair graft. And so are these. So basically what you wanna look for is enough tissue that'll protect the graft as we're implanting them, and also for them to have those little black bulbs on the bottom, which is what grows.
Thank you.
No problem.
Put it in a line,
Align them
before,
with
and
the
then we see it through the screen.
No problem. Mm-hmm. Let me just spray it a little bit.
Marco, your cable is long enough to come here. Like the filter thing.
You want me to move?
No, it's not.
Intro. You can give it a try with this.
Give me a second. I have it. So the first one is.
This one is the 4-hair,
Mhm.
and the rest are all 2-hair grafts. They all come in different sizing.
The camera on the side.
This one, so I'll do these, and then I'll have to turn over.
Just long enough.
Mm-hmm. That's it.
Let's do that, and you can have this.
Be careful.
Move this, then you won't be able to see. Oh, the microscope?
We're gonna hold the cable there.
Okay.
So we won't fall.
Yeah, I'm holding the cable so it doesn't fall out. Let me know when you capture.
Let you know.
Okay. Yeah, they can see it.
Okay. Explain this again.
Wait just a second.
Sure. So this is a 4-hair graft with the 4 little bulbs. You see 3 on the bottom and 1 a little up here. And then the rest of them have 2 bulbs. They all come in different sizing.
One more time. The first one is forward.
This is a 4-hair graft. You see the 3 little bulbs on the bottom. There's 1 a little further up. And then these over here are all 2-hair grafts.
Thank you.
No problem.
Oh, I can make it bigger.
Pause.
Now they can see. Mira la pantalla de atrás.
Let's do an alternate.
Okay, lift your head, please.
Okay, I switched from there.
Your-
You're good, Andrew. Thank you.
Still
Can I use
comfortable?
them?
Yes.
Can I put them in the dish?
Yeah, you can continue. Thank you.
No problem.
Do you have the number?
1 second, I just got a hold of that. Two 11.
Okay. Mm.
I'll just go across.
Yeah.
No other questions?
Any questions? Okay, great. Can hair graft be frozen for future usage? If so, how long?
Yeah, there are clinics freezing hairs, but we don't do that routinely. Cryopreservation of hair. Yeah, there's like banking that some companies offer. Mainly for like research purposes. I think indefinitely. Freezing indefinitely.
What is your opinion on hairline advancement?
We need more specifics. I mean, that question's very broad. You just have to be careful with advancing hairline for younger men because they can continue to recede. A little too messy. I don't remember.
91.
Where do you think we'll finish this up?
Mm-hmm.
Yeah, what one's close? Just too stale.
Sure.
Sorry.
Mm. More.
Yeah. What do you think of that?
291,
Do you have 291?
Yeah.
Mhm.
Plus this, and then you can just have like,
Yeah. So cut this a little bit down. Not bad. I'm using my left hand to help me. See, I'm retracting back. My left hand attempts to help me. Now with my right hand, as I go in, I'm curving because he has a curl to his hair. I have to follow that curl. I can't just go straight in. That's what's taking longer with this type of hair. And because we don't need a ton of grafts, I'm trying to space things out as well as I can. Sometimes it's easier when you just need a lot of grafts, you just go closer or tighter together. now we're going to finish extracting, harvesting the grafts that I've punched, and we will count things up and see how much more we need to take. So in total, what do we have? 381. We'll probably get
291.
No, the total count is
sorry,
381.
381 that we need. Yeah. You want to sit here?
Yeah.
So 381 is what our goal. It'd be nice to have a few extras. How about singles? Are we getting singles?
Most of the groupings are 2s and 3s, so I
Okay.
had to make the 73 for the very.
Okay, so we've made the 73. Okay.
Yes.
Okay. Alright. So yeah, so we'll see if we need to do any more. It's always nice to have a couple of extras as we go back to the recipient area, in case I want to add in a few more before we start placing, or sometimes at the end of placing we start to see little gaps. Questions, Genesis? Let's do it.
Okay.
Let's
Can
answer
you use
questions. Yeah.
Can you use beard hair to fill in the crown area?
Beard hair for the crown?
Yeah.
Yes, we do that sometimes. The beard hair will come from the neck underneath the jawline, and you can put that hair into the crown. That's not our first choice, but sometimes when the donor has been sufficiently exhausted, then we move on to other areas like the beard.
Can you use pubic hair?
We mentioned this earlier. Not the best source of hair. We sometimes put hair into the pubic area for specific cases, but we don't really harvest from the pubic site because the hair is less likely to survive and grow well on the scalp. What else? What else, guys?
No questions.
No questions. How many people are watching?
125.
Okay. So the next part will be fun. We're going to place these grafts back into those sites that I made in the beginning. And my amazing team is going to be doing that part of it.
Okay. Question. Does pulling your hair out is similar as taking out follicles?
No, it's different. Yeah, so we're not just like plucking out hair, because then it's not going to grow in the new location. If you just pluck out a hair like with a tweezer, it's not going to grow. So you need to take it with its nourishment, with its blood supply, and then transplant that whole unit to the new location. And that's the reason why we spent a lot of time punching, which is what you saw me doing. And now those punched sites were is just pulling out carefully, and you can see all those grafts on the scalp surface sitting there, and those are the grafts that then Maria takes and processes just to make sure that everything looks healthy, so we don't take grafts that don't look right and transplant them.
How does the hair stay in the new follicles?
I think they mean to ask how does the hair stay in the sites that we made. It just stays there. The fit is usually like a fairly snug fit. You don't want it to be too tight, and you don't want it to be too loose, so that it just falls out. So you don't want to be too tight either. So it just kind of like stays in there. It can be brushed off, so that's why you have to be extra careful in the first few days after surgery. Because if you're not, you can like rub the grafts off. After about 72 hours, they get more anchored in, just the way the healing process works, and then it's harder to pull them out after that time point.
I'm not sure if you answered this one before, but do people usually get on finasteride before or and after surgery?
Yeah, it depends again on what the reason was. I mean, in this case, this was a congenital spot of alopecia, so this was not from androgenic alopecia. But yeah, for many of our patients with androgenic alopecia, we are recommending Propecia if they're able to tolerate it.
That's 100 million.
Okay. So we're good.
We're good?
Mm-hmm.
So what does that come up to?
4.
That is 391.
And then you'll be doing the ones?
I already did.
Okay.
What do you think? A few more?
You want me to make
Let's
a
make it like 4.
Yeah. Alright, I'll get like another 10 or so.
Let me see.
So we're almost done with this extraction process. You can see that the grafts, the holes, the little scars are going to be nicely spread out throughout this donor. So once his hair grows in, the hair that we didn't take, you really won't be able to notice anything. And even if he were to shave his head, these holes would actually be very, very difficult to pick up on. And part of that is the size of the punch, part of that is the machine that we're using. Things tend to things tend to shrink.
See this, but they can hear you.
Okay, things tend to shrink down. The size of the hole tends to shrink quite a bit because of the machine that we're using and the punch style. This punch, let me show them. This punch has a trumpeted design, and it's shaped like a trumpet, so it's really good for harvesting the grafts. But in addition to that, when the holes heal up, they tend to shrink more compared to some of the other punches that are out on the market. Found a couple more?
Yes. We need 6 more.
Okay. So we're just like 6 grafts away from having our goal met, and so I'm just gonna get a few more, and then we'll get Jonathan up out of this position. How are you feeling right now?
Feeling good, no pain.
No pain. Okay, good. Maybe right here. Yeah. Let's see. Okay, that's what we need. Any other questions?
How much blood do patients lose in the whole process?
So total blood loss, we estimated usually for bigger procedures to be about 20 to 25 cc's. His case can be less than that.
1.
Okay, so wonderful. So we got the 400 grafts out, and again, you can appreciate here, I think, that it's a fairly even distribution as far as the harvest, and it's important to us. We don't want to just harvest 400 grafts from one specific zone. and not, really spread it over a wider area. We also don't need to spread it over a really, really broad area because it's not a lot of grafts. And then the other thing, okay?
Yeah. I'm good.
The other thing to point out is that because of how carefully we did things, when you count the actual number of holes, it's going to be very close to 400. Again, if people are doing a sloppy job, they're going to have to make a lot more holes to get healthy grafts, or they're going to be transplanting grafts that are just not healthy. So, it's just the attention to detail that I think matters for every surgery, including hair, of course. So that's that. And then in a strip procedure, just to kind of give you guys a sense here, a strip procedure, we would say target around here, and we'd just shave the area that we're working on, and literally make incisions, cut out the entire strip, and then on the back table, separate out all the follicles from that strip, and then we would suture everything together. So you get like a linear scar here with stitches that get removed. This is a very different procedure. There's nothing to stitch up. These tiny holes close up on their own, and they heal very, very well. So we're gonna just clean. Let me just get a little bit too much into this one. So sometimes when we have bleeding, we like to hit it with a little bit of medicine to help it stop. Okay. So now we're gonna clean. We're going to apply some ointment to the area. Where are those packets of ointment?
Right there. It's on the menu.
Okay.
Do you need more?
No. We're off on this one. The rest of it.
Yep.
Any other questions from you?
There are.
Whatever sounds appropriate. And let us know, guys, if you have any questions about this procedure, or I guess hair transplants in general.
What are some reasons why the new hair may reject?
You can get poor regrowth, A, if grafts are rubbed off post-operatively for some reason at home. B, if you just had a poor, like the grafts that you selected have poor quality to them and don't have like good blood supply around them. C, your recipient sites were not deep enough and the grafts just, never take because they're too like outside of the skin, they don't have enough depth to them. Those are some of the, and also I would say one of the most important things that leads to poor growth is the way grafts are handled, and that speaks to the caliber of the team that you're working with. You got it?
You're right.
Yeah, so that speaks to the caliber of your team. If your team is inexperienced and they don't know how to work with the grafts, they don't keep them moist, you can't let grafts just dry out on your finger. So you'll see when the team starts placing the grafts, they keep everything moist. And I think this is a great case to highlight. First of all, because it's not a very long procedure, so we have time to talk to you guys and still get through our day. And also because it's like all of these little steps that we're trying to harp on here, they get amplified, when we're doing bigger procedures, and every member of the team has to do their part because you're only as good as your weakest link, right? So that's really very important for overall results is your team, because they're handling the grafts, they're working with them, and that's obviously going to impact on your results. So it's not just the surgeon, it's not just what I do. I mean, I can do my part well, but if I have a team that's mishandling grafts, that's not going to be good for the patient. So so that's why we've got people with decades of experience, lots and lots of experience, and that helps ensure good results. Alright, let me put this down. Alright, let's flip them over. I think, Jonathan, if you want to use the restroom, would be probably a decent opportunity.
Oh, yes.
Is he good to flip? Yeah, just flip the phone. Yeah, just help come out so she goes in one more leg.
So one.
Okay.
No rush.
Let me get the four with the dashboard.
You're welcome. We are going to be back shortly. The patient is on a small break.
It should be no. No. These all 8s here? Are we good?
Yeah, we're looking at you.
Any more questions come in?
Let's see. Any questions? Do you get better at placing the follicles in a more natural pattern, or is it always a struggle to make them seem like they're all natural?
Do you
get better with time.
Do you get better? I mean, yeah, like, you know, the more experience you gain, the better you can make, you know, especially at the hairline. You know, you want to create natural hairlines. Like, that's really a big part of this type of surgery. And, you know, people think, I'll just bring this down. People think that, that like there's a robot that does all this stuff somehow, and it just doesn't exist. Like there's the artist robot that does some extractions to a degree, but the punch size that you saw and the little holes that you saw, most importantly the little tiny holes that you see at the end, are very different than what you'd see from like the artist robot. I mean, night and day. So, you know, I'll challenge someone who does a lot of artist robot to do one of these live surgeries to show people what the holes look like. It's very different. That's why I made a whole video on why I don't think artists and the robotics is prime time yet. Now, maybe one day we'll have a robot to help with a lot of this type of surgery, but at least for now, it's very, you know, it's a lot of manual work, and there's an artistic element to the whole thing. So I think, you know, when people are looking for a surgeon, it's important to, you know, find out if they have that artistic vision. You know, it's not just about how many grafts, like how much does it cost. Like, yeah, those things are important to a degree, but it's like, you know, you can do a lot with like fewer grafts, you know, if you have the artistic eye for a lot of this work. And, you know, so yeah, but of course you get better with time from like the surgeon's perspective. I mean, I think that definitely does happen. But yeah, we're pretty happy with our current techniques. And yeah, someone asked about implanter pens. There's nothing wrong with implanter pens, but that's just one way to do the transplant, and every surgeon finds his or her own way to create nice results. All right. How you doing?
Doing good.
All right. So you'll let us know how you feel up here, but it should still actually be numb from the original injections. But you'll tell us if you start to feel something sharp. We'll just re-numb. Don't keep it to yourself. Okay. All right. Well, let's give us a second and get this more into position. Well, how do you want them on the side again? Okay. Well, would you like this?
Yeah, you can elevate the head right there. Thank you. Yeah.
It's good. Okay, so let's have you back on your side. On the side, just to expose that area. Yeah, perfect. Thanks, Em. And yeah, that's good. And then this will help you a little bit too. That. Good. Let us know how the headrest feels okay. Okay, make sure your neck's not uncomfortable. Okay. Alright, Jen, any other questions? Marco, the AC still good?
Do they see?
AC, the AC.
Oh, AC. Yeah, I'm freezing here, so that's why I had to leave for a second.
Yeah, just a lot of bodies. I'm no legend. I do not. I'm no legend. Just a surgeon.
Consultation to surgery, how long is the wait for patients?
From consultation to surgery? Well, right now we're scheduling consultations for, I think, the middle of November. And then surgical, like delay to surgery right now, I believe is about 4 months, something like that. So, because remember, I do hair, but I also do different facial procedures too. So now, I've seen in some like Reddit forums, Marco, are we on with the Sony?
No, you can still talk. This microphone is always on.
Oh, okay.
So, but right now we're just seeing.
Yeah,
what
you
they're
know,
asking.
just a comment because, you know, we see stuff that people post and mostly it's positive, but, you know, we like to pay attention to the not so positive too. And I've seen like in a Reddit forum, I believe it was, someone said, oh, don't go to Linkov because, you know, he does other surgeries. I think like it's a pretty narrow mindset because the facial procedures that we do, they're very complementary with the hair transplants. And, you know, when I talked earlier about like the artistic like endeavor, the face, you know, is framed by the hair and it has many other components in it. And I think being able to work around all of that is important. You know, I think it's important for hair transplant surgery, and you know, I think then it also complements what I do with facelifts and, you know, other procedures. Like for example, if you're doing a brow lift, it's you have to know what the condition of the brow is. I mean, if you're lifting a really thin brow, it may not be that impressive, but if you can bolster a brow with a brow hair transplant and then get it lifted to a position that's more aesthetically pleasing in someone who's, you know, aged, that then becomes a nice result. So, you know, my message to people who say that is like, just try to kind of open your mind to the idea that there's lots of relevance between hair and the rest of the face. So, you know, and we do a lot of like, you know, beard hair transplant and other things that are like directly on the face. So when it comes to numbing the face, right, I do that stuff all the time for all my other stuff. So it's easier to then translate those skills to hair. Also hairline lowering, I mean, that is intricately involved with brow lifting. So I actually think, and I came to hair somewhat serendipitously. It's not like my whole life I wanted to be a hair transplant surgeon, but I first did ENT head and neck surgery, then I did facial plastics and reconstruction, and got board certified in both of those, and then I came to hair, you know, during my fellowship. So I feel now that having had that background that I do have, it's very beneficial to doing good hair transplant surgery. So I don't know. That's my take on it as a form of defense against some of what was said. I'm all about getting feedback and taking criticism when it's appropriate, but there are certain things that I don't completely agree with. Yeah, I don't know. I felt like telling you guys that. So, but overall, thank you for the positivity online and all the supportive stuff. It's been a huge pleasure putting out content and getting such nice things back from everyone. And also, like I tell some people, it's like a cathartic process because I've obviously experienced my own hair loss issues, so, you know, that aren't easily solved. So yeah, so it's been a cathartic process putting all this material out for me in some way.
Alright, here's a question. Is it better for a woman to get a hairline advancement to reduce forehead?
Well, to reduce the forehead, the two main options are surgical hairline advancement with an actual like incision here, pulling the scalp down, versus doing a hair transplant where we take the hair from the back either with FUE or FUT and then moving those hairs to the front. There are pros and cons of each. We have a video. Mark, are you able to add in a link, or is that too much?
Yeah, I can do.
I don't want the computer to bug out, but if you can throw a link in there, maybe, I think we have one on hairline lowering, you know?
Mm-hmm.
Not the showcase, but the one that's just on hairline lowering. It talks about both options. We'll put in the link. You guys can check out that video, and that's fairly detailed. So let's look here at what the team is doing. You can see this, it's a great visual right now of the grafts being handled with extreme care and being placed into these slits one at a time. Now this is difficult. Is the fit okay?
Yeah.
Mm-hmm.
You know, this is a skill that I could jump in and do a form of this. There's a special kind of, it's actually an implanter pen of sorts. It's not the one that makes the slits, but it's one that can slide into the hole and deliver the graft. That's how I trained in doing this, but you know, this is the part that I leave to my trusted team. They have a lot more experience at handling the grafts with the forceps than I do, and it's a very difficult process actually, because you know, if you traumatize the area, you know, the site and the graft when you're putting it in, then your chances of the graft growing well is lower. Like, it might still survive, but if you cause more trauma, the way that the hair grows in can sometimes be faulty. So it might grow in like extra wiry or in a weird direction because of the way that it was handled. The other thing is that it takes a lot of time to do this. So like, you know, having efficiency and having people who really are very good at this is very important for especially bigger procedures, because you know, you can be careful, but if it takes you all day to insert these grafts one at a time, like it's going to be you know, you're not going to be able to get through a bigger procedure in a day. So again, this is a team sport, hair transplant surgery. It is not. So like, there's extremes, right? On one hand, there's some places where you go in for a hair transplant, you might shake the doctor's hand, maybe they'll draw your hairline, and then they just disappear for the entire day. That's one extreme. The other extreme is like the doctor is just there, they maybe have one other person helping them, and then that's it, and they're just there with you, and they're doing everything. And that's also, in my opinion, not great, because again, team sport. So you want people who are very good and can assist and can jump in and do different parts. So yeah, so that, and then there are certain portions of the surgery that shouldn't be delegated, and that to me is the actual like site making, because the way that the sites were made, as I made them in the beginning of the surgery, as you guys saw, that guides then this growth of the hair eventually. So the way that the hairs are going in are based on the direction and angulation that I made the actual site inside. So, you know, you can't really delegate that portion of the surgery and then really call it like your result. Then it's like the technician's result, or the, you know, I don't know, but it's then not the surgeon's result. So, you know, it gets complicated with like who's doing what portion of the surgery, but again, with long cases, long days, you need a team, you need support, you need people who are good, who will also check you. Like I'm always open, you guys may have heard as we've been working, I'm like constantly trying to get feedback also as I work, because there's a lot going on, and it's good for the team to speak up if they feel like my direction is not appropriate. So I welcome that, you know, I don't want them every 2 seconds telling me, oh no, maybe you should do this or you should do that. But I mean, they're gonna jump in and say something if they see me, you know, going off in a different direction when from their angle they're looking at it, you know, a certain other way. And even if I end up doing what I was doing, it's good to take a break, stop, reevaluate. You gotta check the ego at the door for these procedures, for I think all surgery, and you just have to, you know, kind of trust the process and trust the people working with you. Questions, Mark?
In total, we have had 5,100 people watch
That's cool.
since we started.
Yeah. Any questions?
They're calling them hair worms.
Yeah. We sometimes say they look like little shrimp.
They say they wiggle for days in your scalp.
Yeah. Well, yeah, they do look a little bit like worms. Yeah, or a baby shrimp, we like to say.
I've seen others that have disgusting little white balls afterwards. Why is that?
Well, sometimes it will appear a little bit white on the surface early on because of the skin that surrounds. So we try not to harvest with a ton of skin surrounding the follicle, and that helps reduce that kind of whitish appearance. But that can sometimes come from just a lot of extra skin around there. But there are little crusts that form around the grafts. That's normal as they're settling in. So you can see, so the hairline work here, that is the finer hairs. So those are like the single hair grafts. Like there's one hair coming out of them, and they're finer. And so these were the smaller slits that I made in the beginning. The bigger slits get the bigger grafts, so the 2s, the 3s, the 4 hair grafts. And that's important for, again, naturality.
Where do you prefer to get the hairs for the eyebrow transplant?
It's still, for the eyebrows, it still comes from the back of the head. I generally prefer, so most patients coming for eyebrow hair transplants are women. We still get men, but most are women, and I do prefer to do a strip, an FUT strip harvest, because we can keep the hair longer. As you saw when we're doing the FUE, the hair is cut, the shaft of the hair is cut down really short, right? We harvest short hairs because of the way that the machine is and the way that we harvest. It's just much easier when it's cut short. But the problem is when you're doing eyebrow work, you want to see the curl of the hair. You want to see the curl, and you want the curl to face towards the skin surface. You don't want it to curl out and away. I actually did a consult for a patient yesterday who's from Virginia, who's going to be coming to us for a revision because her surgeon basically, it seems like, didn't really, you know, have the curl facing in the right direction. So she's going to come in, we're going to revise it, but it's easier to see the curl when the hair is longer. It's easier to keep the hair longer if we're doing a strip surgery. So that is one situation where I still prefer to do FUT. You can keep the hair a little longer for FUE, but it's harder. It's harder. It's nice to keep a nice length to that shaft. So that's the spiel about eyebrows.
If you can just repeat how many grafts for this procedure. I believe they just tune in.
Yeah, so this is just going to be just under 400. So it's going to, right now we have about 400 grafts to place. We have about 390 sites, right, about there. So yeah, so we're going to most likely add in a few more sites as these grafts go in. Sometimes it's easier, like when you're just looking at slits, it can get a little difficult to see spacings after a while. But once the grafts are placed, it's a little easier to see like where we have to go in and fill in. So we'll definitely place the remaining, I think it's an extra 10 or so, meaning an extra 10 sites that I have to make and then put the grafts in. And so this is good density, but keep in mind, look at the density in the neighborhood. You know, this is not an area that needs to be crazy tight. Especially compared to, you're not seeing it now, but in the beginning, if you go back to the beginning of the live, his other side, you know, if you look at his right side, this is a pretty good match for density. But again, like with hair transplants, because we have to leave these little spaces of healthy skin in between in order for the grafts to survive and not to injure the actual skin, because there have been cases where, you know, some places, some parts of the world, they create such extreme density with no healthy skin in between, and you can have an area actually die. Like you can have skin death and the grafts won't survive, and you have bigger problems then. So you have to keep things safe. Again, we want to create a nice aesthetic, but first and foremost we have to create a safe process, and you know, that's super critical. So in his case here, the density should be appropriate. But if we were working, for example, into more of his like frontal scalp where it's very dense nearby, we'd have to try to increase this density, and we still wouldn't get to the original density. So that's why I was saying in the beginning, that's where people come back sometimes for additional touch-up procedures with hair transplants. It doesn't mean that it was a failed surgery. It just means that, you know, we got, I mean, unless nothing grew, but, you know, assuming there was growth. And we always take a picture at the end of surgery, and anytime someone, you know, has a question about the way, like how much of the hair survived, all that, we can always go back to those pictures right at the end of surgery and just do a comparison of what grew out. And usually the situation is that, you know, they just wish it was a little bit denser. You know, that does come up. And we say, sure, like we'll just, you know, increase density with an additional sort of touch-up procedure, and that does occur. So it's important to realize that with hair transplants, it can be hard to match original density, especially when the density is very tight with original hairlines and such.
How is the transplant severed under the follicle after it's punched, i.e. the horizontal cut, question mark?
What's the question?
So how is the transplant severed under the follicle after it's punched, i.e. the horizontal cut, question mark?
There's no horizontal cut. Basically, you know, you're punching deep enough into the subcutaneous tissues, and with the type of punch that we have, there's a blunt component to it, and that actually helps, and it's a trumpeted design. So that combination helps prevent injury to the actual bulb. So when you go to like pull it out, as long as you've released sufficient skin around, it just comes out together. There's no extra like horizontal cut underneath it. It just comes out, as you saw earlier. What else?
hair tends to have a certain direction of growth. With these procedures, how is the direction of growth affected?
Yeah, so the direction, when I made the sites in the beginning of the procedure, that's when I incorporated the direction and the angulation. So if you scroll back to the beginning of surgery, when I'm making, with a blue marker, the directionality, I'm observing the direction of the growth, and then I'm trying to replicate that with my site making. But it's not just direction, it's also the density, and it's also the angulation too, and the irregularity, especially because we're working at the hairline. But the irregularity is not just for the hairline, the irregularity is throughout. So what I've seen in some, results for some people is that they have it's almost like rows of grafts. But if you look at natural hair, it doesn't grow like this. There's a scatter to it. So when we're making sites, we try to recreate that scatter, and break up anything that looks too linear as best that we can. So for there was one person who commented on one of our videos that where is the surgical camera that we promised? They're unsubscribing because the surgical camera never came. I feel bad for that person because they could be here now. This is the camera. This is our setup. We don't really say things that we can't deliver on, as you guys may have noticed from the channel. So if we're gonna bring something up, we'll usually be able to deliver on it. We're not here to fool anyone, so
How do you make sure you aren't transacting when extracting, and is it easy to transact by accident?
Yeah, so you saw Ruel closely working with me. I mean, he was right there as I'm punching, especially in the beginning. He's testing. He's looking at the grafts that are, that are coming out and giving me feedback. At this point, a lot of our feedback is very we know what each of us is thinking. He doesn't have to specifically spell out something out. But that type of feedback as you're doing the punching is very important. Because you don't want to make 100 or 1,000 punches and then realize later that, oh man, most of them are transected. A lot of it comes down to feel, both in knowing how far to punch and then the way to punch, but also at the end of the punch. Usually what happens is when it's a good harvest, the graft almost pops out a little bit, and that tells me that it's a good one. Sometimes you can lose it into the hole, and occasionally you saw me doing it earlier, I would squeeze around to see if it pops up. But usually if you're losing a lot of them, that means that something is off. Your angle might be off, different things that need to be adjusted. Sometimes the punch itself just gets dull and you have to change the punch. So, occasionally also we're working with patients, not occasionally, but sometimes there's just scar in the back from prior surgeries or from prior injuries, and harvesting in scar is a different experience than harvesting in normal tissues. So lots of different elements. The direction of the hair as it's coming out of the donor is very important. So asking the patient to readjust their head a little bit is also important. So yeah, tons of variables. But yeah, as you get better at it, you get to start, you start to know which variable to modify. Yeah.
Is there anything that you wish to improve on regarding your current method of hair transplantation, or do you feel you just want to carry on as things are?
That's a good question. I think when it comes to hair transplants, I'm really happy with how things are. I'm actually looking to move away from doing the harvest. We're recruiting more help. I have a physician's assistant starting with me at the end of August who has been doing harvesting for another clinic for a while now, and so we're trying to, if anything, maybe I'm gonna probably phase out of that portion of the procedure. I don't feel like that my skills are required there, but I think it's important. Well, first of all, you have to pick people who can do a great job, but also I can jump in at any time to do the harvesting if needed. But I'm just trying, at this point in my career or where we are in the practice to be able to accommodate more people, because a lot of people, they call in and they're annoyed that they have to wait 4 months to talk to us, and then they have to wait another 4 months to have surgery. So what I'm trying to work on now is like, how do I increase the overall efficiency of the practice but still maintain quality? So I'll never give up site making, but things like numbing, things like, you know, the harvest, obviously the implantation, as you guys see. I mean, I'm really never the one to do the actual like, placing of the grafts in, and that is something that I'm still working on, you know, increasing efficiency but not losing that quality and that involvement. You know, it's a hard thing to do, but as far as the actual steps and as far as our equipment goes, we're very happy. I mean, I don't think there's anything that we would change. I've experimented with using needles instead of these recipient site blades in the past, and I just don't really like it as much. So we've switched back to these little custom blades that we cut. We have a machine for that, and yeah, so overall the process is solid.
Is there an age restriction to do this procedure?
There's no age restriction. I mean, we always have to be careful with, like, you know, people under the age of 18. I mean, they can't sign off for surgery on their own, but like there are some situations, like especially like burn patients, they might be young, and I would always want them to consent themselves, at least like be old enough to somewhat, you know, consent, but then their parents would need to sign the actual forms. But yeah, so they have to be old enough to like be awake for this type of surgery, so you know, at least like, I don't know, 11, 12, something like that. But that's not a situation for like androgenic alopecia. That's if someone has a bad scar, if someone has a burn and, you know, they're being made fun of, like that's, you know, those are rare situations, I would say. As far as androgenic alopecia, you have to obviously be careful with younger patients in like their late teenage years or in their 20s. You just have to be very careful. It's not to say they can't have surgery, but you know, every person has a different hair loss pattern, a different aggressiveness to the androgenic alopecia. So you just have to like take it case by case. But I'm always more weary with my younger patients. But it doesn't mean like a 19-year-old who's like a Norwood 6 or 7 can't have a hair transplant. You know, they can. You know, if they understand the risks and the process. And then on the older end of things, like as long as the person is healthy enough to lay in the chair for the day and get the local anesthetic that we give them, I mean, you know, there's no real upper limit either. I definitely have patients in their 60s and 70s. It's not that common, but they come in, and for different reasons they feel like it's time for a restoration. Yeah.
Why can't you use other people's hair for this procedure?
If you use other people's hair, your body's going to reject it. I mean, it's as simple as that. So, you know, our bodies are, they're usually pretty good at picking up self versus non-self. So if you're putting in foreign materials, other people's cells into your body will see it as foreign and look to reject it. The only way that would work is if you're on like strong immunosuppressive medications, like for a kidney transplant, for example, or like, you know, people who have heart and lung transplants. But that is, of course, not something anyone would ever want to be on for hair. Wouldn't be worth the risks. What else, guys? Let's check in with Jonathan. How are you doing?
Great.
Any pain at all?
No. No pain.
So he's numb from me having numbed him hours ago, and that speaks to the medication that we use. Like I was saying earlier, it's not just, if I just used lidocaine, it would have worn off by now. So we start with lidocaine, but then we introduce our mix that includes marcaine, and marcaine has a longer acting type of property, so that's what allows it to stay numb for like a long time. But there are times when we have to like add in some more medicine. But you can see here, he's doing great from numbing that was placed hours ago. And then, how does the back of the head feel?
Good. I don't feel anything in the back.
It just feels like numb?
Yes.
Okay. Yeah, and I expect the back to stay numb for hours and hours as well. So it's, like I said, like it's a much more comfortable surgery than people I think give it credit for if it's done well and with care. This is not like a scary procedure with like, you know, it can be very controlled, very safe, and we can keep patients very comfortable, you know, as you can see. And keep in mind when we're doing this surgery, like without cameras on, you know, people are conversing, we're usually getting, you know, laughs going all around. It's like a pretty fun experience with most patients. And I mean, some patients just want to rest and sleep, and that's fine. Most patients, you know, want to, you know, talk and chat and stuff. So that's what makes this procedure, I think, pretty cool, and something you're not really getting now, since we're trying to answer questions and we're trying to just I don't know, get through the procedure with you guys. But yeah, but it's not this like, and we're usually playing music, but if we play music now you couldn't hear what I'm saying. So yeah, it's a little bit different. In real life I would say a little more fun, but here we're focusing on like the technical side of it.
That's everyone calling this funny. Wicked Precision Gang.
What?
Wicked Precision Gang.
Wicked precision gang? Yeah. It is a ton of precision. It is. You know, this is like very fine motor. I mean, you know, and look at the finger here of grafts, and look how nice and moist they are. As we see it drying out, we always add more of the solution because we don't want these grafts to be dry on the finger. And so when people are starting to learn how to place, that's one of the things that's easy to forget, because you know, if you're focused too much on what your right hand is doing, you forget what's going on the finger and with your grafts, and that could be, you know, a real problem, because again, you don't want to be transplanting dried out, like pruny looking grafts.
Is it risky for a person with migraine with visual, aura, and temporal unilateral paresthesia crisis to have a hair transplant?
What? What's the question?
Is it risky for a person with migraine with visual aura
migraines?
and temporal unilateral paresthesia crisis to have a hair transplant?
I mean, look, like, could the transplant then trigger a worse migraine or bring on some of your symptoms? Sure, you know, it's possible. I mean, look at how much activity there is here. So it's risky from the standpoint of if you don't want to have any triggers for your migraines, then I would say better to stay away from a hair transplant. But is it like life-threatening? I don't, you know. So it just depends. If you don't want any episodes with the migraines, then don't do the surgery, because I feel like the odds are pretty high that you'll probably get some sort of migraine at some point. Maria Ruel, do you guys want to speak to, like, you know, how, like, from your perspective, how it's what did he say?
Maria
He
will
said I
speak.
will speak.
Maria, just like, you know, what you're looking for. I mean, break down because I know it's so automatic for you now, but just break down the process, like, of putting the grafts in.
So as we're putting them in, what we're looking for is like a little opening that it resembles a paper cut. And the reason why we leave a little of the follicle sticking out is so we can keep a pattern and know what site was already filled and what site was not. That way we don't miss any openings and everything is covered.
Yeah. You can even see right here, there's like this like 3 hair graft, and then in front of it we've got a couple of singles. So we want to make sure that the first few rows, you know, don't have like heavy grafts, because that will then not look so natural.
So somebody asked, is one technician implanting the singles and the other one is implanting the multiple ones? Or how should we-
Right now, yes. Exactly. But like that part of it, like I mean, this team is like so experienced that I don't, I mean, they know what goes where, and as far as like who's gonna do what and what the pattern is gonna be for when they are placing, I stay out of that. You know, I mean, this is a very, very, very experienced team. I mean, they each have, I don't know, minimum 15 years of experience. It's like, you know, so they're very, very, very good, and yeah, so that's that. What else, Marco? How many are in right now?
126.
Okay.
They're chatting between themselves as well, so
Oh,
that's
cool. Okay.
They've been doing that the whole
Should
time.
we give them a sneak peek into our app?
Into the app?
Well-
Don't reveal it. No.
Alright, we're not revealing it. We're working on a hair app, but we won't say much more than that.
You have a great team.
Oh, thank you.
This is true. I concur.
Is the depth of scalp hair follicles different from eyebrow hair, and what are the differences between scalp and eyebrow transplant procedures?
Well, like I talked about earlier, the curl of the hair is super important with eyebrows. As far as depth, it's not like the depth, the follicle needs a certain depth, so the depth is going to be similar. What's different is the angulation. So this is fairly angled flat to the skin surface, but with eyebrows we go as flat as humanly possible, because again, you want the hair to lay against the surface of the skin. But this actually, like this specific scenario, is not too different from eyebrow in that we have a fairly flat angle. But for a lot of scalp procedures, we don't take as flat of an angle. So it's just different. And then the direction of growth with scalp is usually a little, well, we've had plenty of patients with weird directions, but usually it's like fairly like in line, like with what's next to it. With eyebrows, the main thing there's like a certain pattern, we call it like a fishbone pattern, that needs to be observed, like this, you know, kind of meets in from the top and the bottom, and it flows over towards the tail. So that has to be maintained as you're making sites, as you're placing the grafts for eyebrows.
How long would a 1500 graft procedure take?
Depends on a lot of, like, there's lots of variables, but I would say minimum, you know, someone would show up at 7 a.m. and earliest we'd be able to finish would be, say, 3 p.m. That would be on the early side. But yeah, I mean, all of these surgeries just take a long time. I mean, this is like just under 400 grafts, and granted, we're doing a lot of teaching here, but still, I mean, it's still, at least in our minds, like a half-day type of thing. It's not like a 2-hour surgery. Again, if you want to do it well and with care.
I don't know if you want to speak to this. What was your most challenging patient? How bad? Oh, no. So what was your most challenging patient? How bad was the hair loss, or was it a repair case?
You know, it's challenging cases. But I think the most challenging are when we deal with a lot of scar tissue. So like when we don't have a lot of donor on the scalp because they, you know, went somewhere where, you know, so many grafts were taken with one surgery, and now their donor is poor. You know, we extract as much as we safely can from the scalp, and then we go into like the neck and sometimes other body areas. So those are of course going to be much trickier surgeries than the standard scalp to scalp transfer. But I would say beyond that, as far as like personality goes, like I think as long as someone has realistic expectations, we can usually make, a lot happen. But when you have patients who, expect a lot more than what we try to explain to them is feasible, those are people who can end up unhappy and can be difficult to deal with after. So we always try to set expectations appropriately. Most of the time we're able to do that.
Liked, subscribed, and now thinking about Patreon.
Nice. Any other questions?
No.
No questions. Everything was answered.
Well, you talked about this already, but what percentage of...
Do more questions.
Oh.
Yeah. Oh, go ahead.
You already answered this earlier, but what percentage of these transplants stay in? Do some of them fall off? They seem very fragile.
No, they're fairly secure in their holes. Yeah, usually survival rates for scalp to scalp transfers 95%, but in general most survive, almost all.
Do you take young patients at all? Let's say they have been on finasteride for about 2 years.
Yeah, I mean, we talked about age earlier. Yeah, sure. We sometimes will operate on younger patients. Hair transplants on people, let's say in their early 20s, it's doable, but we have to make sure that they're on medical therapy and things are relatively stable, and we have to be fairly conservative with what we're creating. Those patients are not patients who, like the male patients, are not getting their hairlines lowered and all types of stuff. I mean, you have to be safe. And you have to think about the future. Like, I find that a lot of times there isn't like good foresight, and I think it's important to think into the future to decide if something is worth it for a patient. So a lot of patients want improvements in their hairline, and usually it's possible to a degree, but we talk a lot about what's reasonable for them to be happy down the road, not just like a year from now. It's a long-term game.
What training do surgical techs do to get into cosmetic surgery?
What do you mean? Racehorse? Horse racing? Different. I don't know. Jen, do you want to speak to that? What kind of experience have you seen people get that prepares them well to be a hair tech? You gotta speak up there. What type of skills are important? Or backgrounds?
I feel like if you at least have a medical assisting background, you can kind of get into being a hair tech. But I know you can go to there's places where you can get certifications to become a hair tech. But I feel like definitely if you do have medical assisting experiences.
But beyond that, I mean, do you feel like there are certain skills that one has to have to be good? Because I mean, you can go through whatever certification program and then suck, right? I mean,
Patience.
Patience.
You have a lot of patience.
Okay. What else?
It's a lot of movements with your fingers, for sure.
Yeah. Hand-eye. Good hand-eye coordination.
Yeah.
I think there has to be some degree of passion.
Yeah, for sure.
You have to enjoy it.
Yeah.
If you don't like it, these are long days. It's tedious.
Yeah.
It's lots of repetitive movements, and if you don't get enjoyment out of these repetitive movements,
Like you can't do it.
yeah, like when I was younger, I used to do like different paintings and art and stuff, but also like my mom taught me how to like crochet and like other arts and crafts things, and I enjoyed just doing that, doing puzzles, doing. So if you enjoy that process, this then becomes a good fit. If you don't, it's just so you're not going to be happy, and you're not going to make a career out of it.
Yeah, if you're not someone that likes to do the same thing every day, it's like the same routine every day pretty much. If you're someone that doesn't like the same routine, it definitely isn't for you.
Yeah, one more thing about what I was saying earlier related to how I do other procedures on the face. It helps my hands to be able to take breaks from like some of the hair transplant methods and techniques, and break from that and do more like suturing and other types of hand movements that I need for my other procedures, and then like because it kind of like rests your hands in a way too, because you're changing around the movement. So I think for just overall maintenance of fingers and and keeping your body right, I think it is helpful to go between a few different procedures, but it's just something I've noticed.
We got a $5 donation with a question.
Okay.
Even though you're taking hair from the back of the head, how do you make the frontal hairline look like frontal hairs?
I mean, the hairs are still just scalp hairs, so they have very similar characteristics. But like I mentioned earlier, the first few rows of what we're placing are like the single hair grafts. So they're finer hairs that are placed along the front. And what we were finding, and did we show how we were splitting the grafts or no?
No.
So one thing we didn't show you guys that is an important skill is being able to split grafts. So what Maria was doing earlier under the microscope was that she was noticing there weren't enough single hair grafts. So she was taking the heavier hairs, the 2s, the 3s, and starting to split them up so as to create these single hair grafts. So we don't always get what we need from the back. So it was a good question. And when we don't get what we need, meaning enough of these fine hairs for the hairline, we create them. So again, that speaks to the experience of the team. If you don't have someone on the team who knows how the hell to do that, then I can't do that, for example. I mean, I could probably maybe try to figure it out, but that's a specific skill. With hair, there's lots of these little specific skills. And just because you can do one of them doesn't mean you can do a different part of the case. So you rely on like a strong team to help you out and to be able to do some of these things. So splitting grafts under the microscope is very important so that we can get enough of the singles to create more naturality and at the hairline, and to make it fit with other areas in the vicinity.
What is the recovery like after hair transplant? Is it painful, and what things to avoid while in recovery?
Recovery is not bad. The first week is when you can experience some swelling in the area where we worked. We do use steroid in our mix as well, and we have patients take a steroid pill. But even with that, there could be swelling because we injected this area. There's also just all the manipulation. This swelling will kind of come down the face over the course of the first week, and then it gets resorbed and goes away. So that's something that is important to keep in mind. There's a process of getting the hair wet, and we go through this with patients where the next day, tomorrow, they start with a spray for the recipient area, and the back just gets some antibiotic ointment. And then typically, in most cases, this one's a little unique because of the angle of the hairs, so we're going to be careful, but in most situations, we're going to ask patients 48 hours later to take a basin of water and pour it over their head gently every day, and then day 6 we allow for like regular showers, and then at that point they're working out some of the crusts that are in the area. So by the end of the second week, most of the crusts are gone, and after about 3 weeks, the little shafts that we've placed, those little tiny black hairs, actually fall out. And then like 4 to 6 months after surgery is when you start to see the new hair sprouting at different rates. They don't all come in on the same day. It's a gradual process. And then after about 10 months, we have like 90% of the result. That's when we like to see people back in the office and kind of see where we're at. Final results can take up to like 1.5 years. You know, can take some time.
Okay. Is it possible to graft hairs on an area where there was a wart that was recently removed?
Well, if you had a recent removal of a wart or any kind of procedure, I would recommend waiting at least 3 to 4 months, or 3 to 6 months before doing a transplant. And you want the area to settle down. If there's a lot of inflammation still, that can hurt the hair that you're putting into the site.
Do you need prescriptions to start medical therapy?
Yeah, I mean, you need prescriptions. You can try, well, for the oral ones, you can try like topical Rogaine, that's over the counter. There's like laser caps, PRP, microneedling, as we talk about on the channel. But in terms of like pills, like a finasteride pill or a minoxidil pill, you're going to need to get a prescription for that.
Should microneedling and minoxidil be avoided before surgery to better represent a stable hair loss pattern?
Well, I mean, I wouldn't do the microneedling and minoxidil like the day before surgery, but in general, you don't need to avoid it. If anything, you'll need to maintain it after transplant surgery. And not right after, but after about 3 weeks, you can resume it.
Someone asked, do most doctors who do hair transplants have transplants?
Do most doctors who do transplants have transplants? I don't have an answer to that exactly. Like some hair transplant surgeons that I know like have gotten transplants and others have not. So I don't know about most, but
It's like 50-50.
maybe
I guess.
50-50, yeah.
Because I've worked with doctors that do have.
Yeah, probably like 50-50. I can tell you that I'd probably consider it, sure. I think I'd get one if I had like, you know, the standard patterns.
Do I have to stay out of the sun after the transplant?
Yes, you do want to protect the area from direct sun exposure, and the longer you can do that, the better for healing. You want to roll back, or are you okay?
I'm okay.
You good? Do you need any like counter traction?
I'm doing it as I go. That's why you see me going
You're
like
fine?
this. Yeah.
Does the surgery trauma from the donor area cause regrowth issues or promote regrowth of the hairs left behind, similar to microneedling?
At the recipient or
I guess the donor area.
donor area? Read that one more time.
So does the surgery trauma from the donor area cause regrowth issues or promote regrowth of the hairs left behind?
Yeah, so generally the donor heals in very nicely. There's always a chance of some shock loss where temporarily you put the neighboring hairs into a shock type of state, so it can take them longer to grow back. But we don't see that very often. I would say like very rarely. I mean, maybe 2% of the time there's some temporary shock loss, and that could happen in the donor or the recipient.
Are you able to transplant hair in places where you've never had hair before?
Yes. You can transplant hair to areas where there's never been hair. Like, that's what we do with hairline lowering procedures, especially for women.
Does finasteride reduce in efficacy after years of use?
No, usually it's still highly effective. Sometimes people will find that certain types of finasteride from certain factories will be less effective than like say Propecia, which is from Merck, or some other finasteride companies. So usually when people find that the efficacy seems like worse, I usually recommend they go to Propecia, which is going to be a little more expensive but more reliable.
Is there any chance hair may never recover after shock loss?
Yeah, there's a chance, but it's very low.
If a patient specifically wants to get an unnatural type of hairline, like very straight or very rounded, do you try to convince them to do a more natural shape instead, or do you just do what they ask?
Yeah, no, I mean, you guys know, I mean, I'm like very, like, I don't know, honest about that stuff. I'm very straightforward, and my aesthetic has to more or less, you know, be similar to what they want, because if it's totally different, then I'm probably not the right surgeon for them. There are some situations where you have to consider, like, what's accepted in a certain, like, say, ethnic background or something like that. So there are different factors, and you know, so you know, that's a nuanced kind of response. But generally, it has to still fit into like what we consider to be safe and effective in terms of design. It can't be something that they just kind of thought of and, oh, this is how I want it. It's got to work with like what their donor looks like, how many grafts we can get. There's lots of factors there.
Would this procedure be exactly the same for beards and mustache?
Yeah, I mean, it's the same steps, you know, and actually the angle of growth is similar. It's very acute also in beard and mustache. Not as acute as eyebrow, but still fairly acute. So from that perspective, it's a very similar thing.
Okay, I'm thinking of getting an eyebrow transplant. Should I get the microblading lasered off before the transplant?
You can leave the microblading on if you want to get an eyebrow hair transplant. Sometimes it's good to kind of like guide us. If you like how the microblading looks, we can use that as a template and put hairs into that same zone. How you doing?
Well,
Doing fine?
Yes.
Okay. Yeah, we're moving along nicely. Everything's going well. Any other questions?
They're mostly repetitive about the
Repetitive.
eyebrows.
Oh, I
Like,
know.
where are you getting them from?
If we're not answering questions, it's most likely because we've answered them earlier today already. So just you can look back or later rewatch the video from the start and you'll see.
Does PRP work on scars?
Well, in what way? I mean, does PRP work to help with the hair growing in scars when you place the hair there? Yeah, to a degree. We usually like to use PRP in cases where there's a lot of scar tissue. I think to a degree it can help, but just putting PRP into a scar is not necessarily going to make the scar better, but it might help with some degree of graft survival. It's just like a tough thing to answer because there's so many different types of scars, you know, but usually there's some benefit in doing that.
Is straight hairline desirable?
Is a straight hairline desirable? I would say in most cases we don't try to create completely straight hairlines. But again, there are some cases where that might be appropriate. Ruel, can you talk about when you grasp the graft, like what portion of it? Maybe just show like the different portions, and then show like where you're grabbing so that they can see.
So this is the graft. You can focus that.
Yeah, it's good. It's in focus.
So these are the bulbs. These are 2 hair graft. So you can grasp it like here, not squeezing the bulb. It should be like really
So you're above the bulb.
above the bulb, and you should be really light touch.
So he's
You're not
Oh,
you're
well, we're-
not squeezing the bulb, and then
No.
you insert it into the hole, and then after you inserted the bulb into the hole, you hold onto the middle part, and then you push it.
Yeah. And what about like dunking it too far in? Why do you leave it a little out?
Well, you have to leave it at first, just like what Maria was saying. That's you, so you will see which holes have been filled up already, and to avoid like piggybacking. And also, if you put them way too low like that, when it heals up, there will be dimpling of the skin,
Pitting.
pitting. Yeah.
Yeah. Thank you. So
If it's too high, there's also the danger of them being dislodged.
yeah. Yeah, exactly. And even if they're not dislodged, like they might just not take because you know the bulb is not deep enough in the tissues for it to survive. So and again, this goes back to the depth of the actual site that we made, right? You saw me making the sites earlier, and there's a certain length to the blade, the way we put it on our blade holder. The depth has to be appropriate so that if it's too deep, then it might be easy to sink these grafts into that hole. If it's too shallow, as Ruel goes to push it in, it's just gonna like sit too proud, and it's not gonna have the space to go deeper. So all these things are relevant, and one step influences the other step. You know, it's there's lots going on, lots of variables.
So many of them are asking how much per graft.
How much per graft? So, you know, pricing varies from place to place. If you want pricing in our clinic, just call the office. They'll give you our current pricing. Some places charge per graft. Most places will have case minimums, right? Because this still is an involved process, even with a small number of grafts, as you can see. Some places, and I'm considering moving towards this, some places charge by like per surgery, regardless of how many grafts, right? Because at the end of the day, yes, there's a certain number of grafts that we've moved, but the whole process is like an artistic endeavor, right? I think about it also like when we're doing like a lip lift, for example, and I'm taking off a certain number of millimeters. I don't charge people more if I go to 6 millimeters or if I remove 3 millimeters, because I still have to do the whole surgery for them. So in some ways that's relevant here. Even for sometimes fewer number of grafts, it still takes us the entire day of effort, and the same size team. So there are some places where they'll just charge per case and just a flat fee, and some places have a couple of categories like small case, medium case, large case, and each one will have a certain amount of money associated with it. So we're seeing like what might work best for us. I don't necessarily love the per graft pricing, but it's what I guess most people do. It reminds me like when I was doing injectables. These days I have like a nurse who does the like Botox filler stuff in the practice, but when I was doing it myself, when it came for like figuring out Botox pricing, it was like most people were doing by the unit, but plenty of people were also doing by the area, and I like the idea of treating like an area, right? So I did it that way. But now that we have our nurse in New York City, most nurses are charging by unit, so we've switched back to that. So you can see, like, I mean, things change. Like pricing models can change. What we're trying to do, which is exciting and relevant today, is we're trying to get sponsors. You guys saw some of our recent videos are sponsored, and that's great. I mean, I'd rather take some of that sponsor money and give it right back to patients. So we're trying to figure out a way to best do that, so that a person coming to us gets essentially like a rebate of sorts for being willing to, maybe not necessarily go live, but at least let us like film the experience and post it on YouTube eventually, and maybe have a sponsor like subsidize their surgery. We haven't yet gotten there, but we're hoping in the future that there will be some form of that, and I think it'll be great for patients. It'll be fun for everyone to kind of see their process and why they decided on surgery, how surgery went, maybe do some follow-up stuff, really show the full experience. So that's our hope and our goal. So people don't have to necessarily fly to a different country to get surgery just because it's cheaper. If we can bring down costs for some of these bigger hair transplants that can get expensive, then that would be nice.
Okay.
So if there's any sponsors out there, or anybody who has a business who wants to sponsor a patient, to get a hair transplant, let us know, and we'll gladly talk about you and say how wonderful your products are, if they are wonderful, and make the whole system work.
So, what's the youngest and oldest patient you've done a hair transplant on? And does the process change at all depending on age?
Well, when I was training with Jeff Epstein in Miami, we had a patient for a hair transplant who was like 13, a burn patient. So he had a big burn on the side of his head that led to a lot of hair loss. And so we did a transplant. He did great. So that was probably the youngest I've ever worked on. And then the oldest, someone in their 70s. I mean, we don't really get patients past their 70s for hair transplant usually. So yeah, just like 70s.
It's a question, but I'm not sure. It goes, does hanging upside down do anything, or was the documentary Dos Bigelow spreading false info?
I don't know anything about that.
Me neither.
Hanging upside down? I don't know. I'm gonna
Can
be.
the hair be colored after a transplant?
Yeah, you can color hair before, and you can also color hair after. But for after, we recommend about 3 weeks, and gentle dyes that are natural and all that. But yeah, sometimes people will color it before because it is a little harder to extract grafts that are like white or gray colored. We can do it, but it's nicer when they can color it.
Can you use leg or beard hair?
Beard hair we talked about, we do use that on occasion. Not leg hair. There's like maybe one clinic in California that does like thousands of leg hairs, but they usually don't look that good.
Will the redness in skin dissolve in the transplanted area? I've seen some friends that keep the pink/redness even months after the surgery.
Yeah, the pinkness, redness, that is variable. Everyone's different when it comes to that. So in most patients, I would say within a month, it's like significantly better, if not gone. But some patients it can be months for some.
Does a FUT procedure create a facelift or facial forehead tightening effect when the donor strip area is sutured?
Oh, interesting question. The question is, if you suture up an FUT
Will it
incision,
will it give you like a facelift?
does it give you like a facelift because you're tightening the back? The answer is no, because it's too far back. It's too far from like the front where you're trying to, I guess, theoretically get some tightening. So no, we don't see any facial tightening from a FUT incision that we close. But that's an interesting question. I'll be right back. You good, Jonathan?
Yes.
Okay.
That give me a thumb again. How you feeling? Perfect. Thank you.
was our time for the sites? 381, is it?
Yes,
Yeah.
that was what you guys said.
See that?
Huh?
Need more sites.
Need more. So should I leave the dish there?
No?
Okay. Could you let him know when we need more sites? John.
Yeah.
More sides, yeah. We don't need any.
16.
1-6?
Yeah.
Let me get the detail of your hands. Can you please hold for 1 second? Since I thought.
Oh, did they take the blade?
Almost. Okay. Go.
Oopsie.
What?
Normal speed.
Oh, the blades are there.
They're there? Everything going okay?
Mm.
Good. How's it going, Mark?
Good.
Good, there was a lot.
Let's have Genesis look. Also, Bianca had a question.
No problem.
And then also for you, she wanted to
Oh.
talk to you too, Andrew, as well. Okay, so now we have, how many, 13?
No, 15.
15, okay. These are our 8s, right?
Yes.
So we've placed all but 15 grafts, and so now I'm going to make some additional sites for the remaining grafts. We're good on those singles, yeah?
Mm-hmm.
Is it still cold over there?
Yeah.
Really?
Yeah, I'm like an ice cube here.
That's amazing. It's like here is like warm. Man.
Really?
Hard to believe.
So warm here.
No, here I'm like frozen. It's good because it's keeping the laptop cool as well.
These look like 6s. I guess you have fresh 8s here. I guess the ethanol had dried out.
Mm.
Yeah, this looks like a
Can you move up the bed, please?
Oh, yes.
Yes. Walk towards me.
This way?
Yeah.
Oh.
I mean, same.
Same.
Okay. That's
Like
good.
So Marco, can we show them here?
Yes.
Good. Well, what I'm trying to show is like how I select the length, because I can have a blade that is this long, but this is only gonna, tell me when you're ready.
You're good, but it doesn't go that zoomed in. Like they can see it, they
Okay.
can see the blade, but it's not.
Yeah, so this would be too long because it would just injure some of the blood supply without being necessary because the grafts aren't that long. Or I can make it this short, but then that's going to create grafts that stick out and are too proud. So instead, we choose something in between. Something like so. That is deep enough. And you can measure and all that, but there's like a certain point, like you just see it. You see what you need to do.
Here you go. You can also use this camera
Oh.
if you want to show it. Just a second.
I was just pointing out.
Oh. Yeah, once it's focused, don't move. Yep, there.
So I was just pointing out the depth of the blade. You can see the depth that I've selected here. It's not too short, it's not too long, and it's going to work for what we need to do to make these additional sites.
Again,
What? I would say right here.
Yeah.
Are they seeing? Marco?
Now they can see you.
They can?
Mm-hmm.
Change it up. No pain?
No.
Sometimes we get into a little bit of bleeding, and usually we either hold pressure or put in a bigger graft. Sometimes pressure is all we need. Bigger. So we're just going to select the bigger graft that's going to plug up the hole better. So you see, like that graft was bigger, so it sealed up the bleeding better. This is just some of the refinement work. And you can see that because it's been a while now, the area is getting a little oozier compared to when we first started. But we only have a few grafts left, so we'll get through it.
Somebody was asking if you can use another gun.
No, we've already answered that.
Two.
Any questions, Michael?
No.
Everyone got their questions answered? How many people stopped by?
In total,
Yeah,
6,482.
it's nice.
You see that shot of the surgical camera on top, so when you're talking about it, you can have it.
Okay.
How many languages does Dr. Gary
Last one.
speak?
2. Let's just double check it. So we're done with putting all 400 grafts.
Oh,
Are you okay?
yeah. I couldn't see my way.
It's right by your right shoulder.
We need a helmet for the camera.
Yeah, I ordered a handle.
No, a helmet.
What?
A helmet for the
A
camera.
helmet. Oh.
You ready?
You good? Yeah.
Switch to this one.
Yeah, just keep it on.
Mm-hmm.
You want to see where I'm? You want to sit here? There's something there. There's something. Yeah, let's just see where. And now we're just checking to make sure all the grafts are sitting nicely. Just grab this out. This goes. What? Took the graft. That's good. Let's push this way. That's great. So the biggest thing out there is to not rub that hair head, okay?
Sure.
And the biggest thing. So how do you feel?
Well, I don't feel anything. Yeah, so no pain
No pain, okay.
so far.
Uh-huh. Good. Is this sort of what you expected, or different than expected, or
No, I was expecting. I was very nervous because I never been surgery before.
yeah?
On any procedures, and me it was. You made it all of you guys made it so easy,
Awesome, man.
and that's why I was very calm. And yeah, thank you.
Super glad.
Yeah.
Super glad. Awesome. You did so well. Thank you. Thanks for letting us film.
Thank you, guys.
Thanks to my amazing team.
You're welcome.
Not you, Andrew. All right. So we can maybe bring you up, Jonathan, and we can show the people sort of how it looks, even though it's obviously swollen and stuff. I'll help you out in a second. Your head okay?
Yeah.
And yours too.
Just bumping.
Everyone's head okay.
Just bump it.
Head still screwed on. Alright, Marco, let's switch this some. So just slowly roll off here. Take that pillow from here. Great. Now we're gonna just do photo, so we can face the people. Marco, can they see us? Bring that. Do me a favor. Bring that camera towards the
Yeah,
wall a
I
little bit.
will.
Just so it's not in people's way. Okay. It's fine. It's fine. Yeah, we can. Yeah, they have to clean it and stuff. So yeah, just.
Bianca has a question for you.
We're good on this. Can you see us over the top of this one?
Not right now. Just a second.
Do me a favor, I'll just take this thing off. It's just in our way. We can just take the whole thing, the whole thing on. Okay. You good?
They can see you guys.
Oh, okay. All right. So I just wanted to thank Jonathan for allowing us to broadcast this case. A lot of patients who come to us, they really just don't want. Are we okay, Marco? Yeah, that's fine. It's good enough. Turn this one off. A lot of patients who come to us, they're just very worried about their privacy, and we respect that. We understand that. But we also like the opportunity to show everyone, how this stuff gets done, so that people are less afraid and just more knowledgeable about the overall process. So it takes patients as brave as this one to allow us to do that. And again, this is not a one-man show, so just wanted to thank my amazing hair technicians, including Maria.
Thank you.
Maria Ruel, Genesis. Genesis was mainly on the questions along with Marco today, so she didn't actually get into it. When we have bigger procedures, we need multiple people doing lots of things, but that was great. and then we have Andrew filming, and we'll try to create like a showcase video as well, in addition to this live. And of course, Marco, you want to show your face? You guys never get to see him, but here's Marco. Marco is the OG video editor.
Hey guys.
He makes this channel possible. So you know, without him, we wouldn't be here. So that is amazing. And so thank you, Marco, for everything you do. Great. So yeah. So we'll do some version of this again in the future if you guys enjoyed it. Are we good?
Yeah.
Oh, good. Yeah. Great. So any other final questions from people before we go?
They're saying you're looking great.
Thank you.
Thank you. Thank you.
He's cute.
Oh, you got some dates out of it.
Thank you for answering all our questions. Thank you everybody. So everybody's just
Okay, thank you everyone for joining and for watching. We appreciate